अब आया होगा। Hi, good morning to all of you. Uh, Anyone who is there, please confirm me about audio and video. Audio, video, all fine. Anyone who is there? Anyone who is awake early morning, Sunday morning? Yeah, good morning to everyone. Audio, video, all clear? Okay, thanks. Yeah, thanks, doctors. Thanks for the confirmation. Right. So, let's revise yesterday's topic. So, we discussed three types of medicines yesterday. We discussed about cholinergic drugs. We discussed about anticholinergic drugs, if you remember. And then we started with adrenergic drugs. Right? So, in cholinergic drugs, we discussed about some directly acting medicines, some indirectly acting medicines. In directly acting medicine, we discussed about bethanechol, if you remember. We also discussed about pilocarpine. In indirectly acting medicines, we discussed two types of medicines, reversible and irreversible blocker. In irreversible blocker, we discussed about organophosphates and carbamates. And in reversible blockers, we discussed further two classes. Medicines can be tertiary, medicines can be quaternary. Tertiary medicines are those which are given for CNS problem, like donepezil, which is the drug of choice for Alzheimer disease. And we discuss about quaternary medicines like pyridostigmine, which is given for myasthenia gravis. In anticholinergic drugs, we discussed about some non-specific medicines, non-specific blockers like atropine and hyoscine. So atropine and hyoscine are non-specific drugs. And we also discussed about specific medicines which can be blocker of M1 or M3. M1 blocker or M3 blocker. M1 blocker, two types we discussed yesterday. Medicines which act on GIT like pyrinzapine given for peptic ulcer disease. Medicines which act on CNS like benzhexol given for Parkinson's like symptoms. M3 blocker, we discussed four groups. Medicines which are given in the form of eye drops are mydriatics and cycloplegics. Medicines given by inhalational route are bronchodilators, right? And the third is medicines which act on glands. The drug is glycopyrrolate, if you remember. So glycopyrrolate will act on glands. After this, we started with the medicines which are known as adrenergic drugs. Now, adrenergic drugs, we discussed that these medicines are of two types. Number one, directly acting medicine and indirectly acting medicines. Now, in directly acting medicines, we discussed two types of medicines. One is known as catecholamine. And the second is known as non-catecholamines. catecholamines and non-catecholamines. In catecholamines, we discussed about 6 medicines yesterday. First is dopamine, second is adrenaline, third is noradrenaline. So these three are the natural agents, and some artificial agents are like dobutamine. The fifth is phenol dopam, and the sixth was isoprenaline. So these are the 6 catecholamine we discussed yesterday. Now we discussed that dopamine is given in 3 type of dosing schedule: less than 2, 2 to 10, and more than 10. And in these 3 different dosing schedule, medicine will act on 3 types of different receptors, and it is a drug of choice for cardiogenic shock with oliguria in a dose of 2 to 10. It's the second drug of choice for all type of shock in dose more than 10. Adrenaline is a drug which is agonist of all type of alpha and beta receptor, that includes beta 2 receptor also. So very important is adrenaline can act on beta 2 receptor, and therefore this medicine is a bronchodilator. So this medicine is a bronchodilator, and this is drug of choice for anaphylactic shock. Because of this bronchodilation property, plus medicine can increase the blood pressure, it is drug of choice for anaphylactic shock. And also this is drug of choice for cardiac arrest. For cardiac arrest and anaphylactic shock, this medicine is given in 2 types of concentration. One is to 1000 and one is to 10,000 concentration. Then we discuss about noradrenaline. Noradrenaline is a drug which will act on all alpha and beta receptor, but this medicine will not act on beta 2, and therefore this medicine cannot cause bronchodilation. For the same reason, this drug is not useful for anaphylactic shock, but overall this is drug of choice for all type of other shocks. This is drug of choice for all type of other shock, right, but not of anaphylactic shock. Now dobutamine is a medicine which is exclusively active on beta 1 receptor. So this medicine has 2 important indications. So medicine has the word do stands for 2 important indication. The 2 important indication is it is given for cardiogenic shock and also given during stress echo. So medicine is used during stress echo as well as useful for cardiogenic shock. Now phenol-dopam is only stimulator of D1 receptor, and because this medicine is stimulator of D1 receptor, this medicine can lower the blood pressure and can increase the GFR. Right? Medicine can lower down the blood pressure, can increase the GFR, and isoprenaline is a medicine which is stimulator of all beta receptor. This is stimulator of all beta receptor. So these were the catecholamines. Now we discussed about non-catecholamines. In non-catecholamines, we have 3 group of medicine. Number 1, medicine which will act on alpha 1 receptor. So the medicine which act on alpha 1 receptor, the main drug was phenylephrine. So we discussed this medicine, phenylephrine. So phenylephrine can be given in 2 forms. One is eye drop, second is oral or IV route, the systemic route. Now being an eye drop, this medicine can cause mydriasis. Medicine will cause mydriasis, but there is no cycloplasia. So without cycloplasia, medicine will cause mydriasis without cycloplasia, and by oral and IV route, this is considered as drug of choice for hypotension. This is considered as drug of choice for hypotension that is seen after spinal anesthesia. Drug of choice for hypotension that is seen after spinal anesthesia. So phenylephrine is a drug of choice. Now we have some other drugs also which are alpha 1 agonist. So some nasal decongestants also present. So we have some nasal spray, so we call them decongestants, and the names are oxymetazoline, xylometazoline. If given for long time, these medicines will cause atrophy of nasal structure. We call it atrophic rhinitis. Medicines which are alpha 2 receptor agonist. So we know that alpha 2 receptor has 2 locations. One is central nervous system, second is ciliary body of eye. So these medicines will have 2 important indications based on the location. So there are 2 medicines like clonidine and alpha methyl dopa. So clonidine, alpha methyl dopa will act on CNS and inhibit the vasomotor center. Reduce the blood pressure, and medicines are given for the treatment of hypertension, typically seen in pregnancy. So pregnancy induced hypertension, we use these medicines for treatment of PIH by acting on CNS. Medicine can inhibit ciliary body of eye and therefore reduce aqueous humor synthesis given for the treatment of glaucoma. So there are 2 more medicines which are given for the treatment of glaucoma. Medicines names are brimonidine and epreclonidine. So brimonidine and epreclonidine are two medicines which are given for the treatment of glaucoma. Now both group of medicines, because they take entry in CNS, there is a risk of respiratory suppression, and because of the risk of respiratory suppression, these medicines are avoided in children and neonates. So medicines are avoided in children and neonates because medicine can take entry in CNS and can suppress the respiratory center. This is an important side effect of this medicine. Now apart from that, if we talk about the unique side effect, alpha methyl dopa can induce the antibodies and can lead to SAD-like symptoms, and autoimmune hemolytic anemia, and these medicines can cause retraction of eyelid. These medicines can cause retraction of eyelid. These are the alpha 2 agonist. Now after alpha 2 agonist, we discuss the medicines which are beta 2 agonist. Medicines which are beta 2 agonists, there are two types of medicines. Medicines which act on bronchioles will act as bronchodilators, and medicines which act on uterus, we call them tocolytic medicines. So tocolytic medicines are ritodrine, and isoxaprine. So isoxaprine and ritodrine are tocolytic agents, and bronchodilators are further of two types. Medicines can be SABA, medicines can be LABA. So SABA drugs are those which have the word buta in their name, like salbutamol and terbutaline, and LABA are the drugs which have metro word in their name, like salmetrol and formoterol. Now out of these four, the formoterol is a very important drug because formoterol has long action as well as fast onset of action. So that medicine we use nowadays as a first line drug for bronchial asthma. Now these medicines when given to a patient can lead to 6 important side effects which you can remember by a mnemonic 3T and 3H. So this is what we have discussed till yesterday. Now if you people have any doubt up till here, you can ask, otherwise I will ask question from you. Anyone has any doubt in yesterday's topic, please ask. If you have any doubt, please ask. Otherwise I will ask question from you. 3H. H stands for hypokalemia. H stands for hypokalemia. So please remember, whenever we give salbutamol to a patient, because one student wants to know the reason for the side effect. Please remember, salbutamol will act on skeletal muscle, and by acting on skeletal muscle, salbutamol will act on beta 2 receptor and can induce one pump, can stimulate one pump. The name of the pump is sodium potassium ATPase pump, and because of the sodium potassium ATPase pump, potassium takes entry inside the cell and sodium comes out of the cell. Potassium take entry inside the cell and sodium comes outside the cell. So in this way, the potassium which will enter in skeletal muscle, the level of potassium will go down. Level of potassium will go down in plasma. This is the hypokalemia. Second is hyperglycemia. So salbutamol can also cause hyperglycemia. So we have a liver. On the surface of liver cells, we have beta 2 receptor. So salbutamol will act on beta 2 receptor, and by acting on beta 2 receptor, this will stimulate the glycogenolysis. And can also stimulate the gluconeogenesis. And whenever there is a glycogenolysis and gluconeogenesis, the glucose level will be raised. Third is, this medicine can cause hypotension. So very simple, beta 2 receptor when stimulated, this beta 2 receptor is a relaxant of smooth muscles, so blood vessels get dilated. When the blood vessels get dilated, the BP will fall. So these are the reasons for hypokalemia, hyperglycemia and hypotension, right? Okay, next question is, noradrenaline is drug of choice for cardiogenic shock. It's a drug of choice for cardiogenic shock, and in cardiogenic shock, most of the time BP is low. Cardiogenic shock is a condition. If you look at my hand, now look at my hand, the heart contracts like this way, 1, 2, 3, 71, 72, right? But in patients of cardiogenic shock, look at the contraction of heart. The heart will contract like this way, 1, 2, 3, 4, 71, 72, or it will contract like this way: 1, 2, 3, 4, 5, 71, 72, 81, 82, 91, 92. So number of contraction is not an issue here. Number of contraction is not an issue in cardiogenic shock. The issue in cardiogenic shock is the force of contraction. So the force of contraction is not there, and therefore cardiac output and ejection fraction is low. And we discussed yesterday, BP is equal to cardiac output into peripheral resistance. So if your cardiac output is low, BP will automatically come down. So BP automatically comes down. So in patients of cardiogenic shock, most of the time, like more or less, you can consider in cardiogenic shock patient, BP is always low, right? एड्रेनलिन के डोज बताओ भाई. सम स्टूडेंट हैज कंफ्यूजन इन एड्रेनलिन डोज. सो एड्रेनलिन is present in two types of concentration. Who will tell me the concentration? So okay, fine, don't tell, I will tell. 1:10,000, 1:1000. There are two types of concentration of adrenaline: 1:1000, 1:10,000, right? Just remember, 1:1000 we use for anaphylactic shock. We use this preparation for anaphylactic shock, and 1:10,000 we use for the treatment of cardiac arrest. 1:10,000 we use for cardiac arrest. The dose of anaphylactic shock is 0.5 milligram. Here the dose is 1 milligram. So cardiac arrest में we give the double dose because the patient condition is very down. But in anaphylactic shock we can solve our purpose with half of the dose, 0.5 milligram. Right? Now if I ask you this question, 1:1000, like this is a bottle. So bottle of adrenaline comes like this way. So in this bottle the dilution is 1:1000, and this bottle contains 1 milligram drug per ml. So total 25 ml drug hota hai ye. Total 25 ml solution is there in this bottle, which contains 1 milligram per ml. Now if I want to give 0.5 milligram drug, then I have to give only 0.5 ml of this liquid. So I will take out 0.5 ml of this liquid, which is total 25 ml, but I want only 0.5 ml out of this bottle, right? So the route of administration is intramuscular route. This is for anaphylactic shock. Now if we talk about cardiac arrest, the cardiac arrest में जो preparation है वो है 1:10,000. So this bottle is 1:10,000, and this contains 0.1 milligram per ml. It is 10 times more diluted. 1:10,000 का मतलब क्या है? Drug is 10,000 times more diluted. 1:1000 means drug is 1000 times diluted, and 1:10,000 means the drug is 10,000 times diluted, 10 times more than the previous preparation. So in previous preparation it's 1 milligram per ml. Now when it is 10 times more diluted, it is 0.1 milligram per ml. तो ये भी आपका 25 ml का total liquid है. Now out of this liquid, how much quantity of drug you will take out? So if I want to give 1 milligram drug, if I have 0.1 milligram in 1 ml, so if I want to give 1 milligram in one go, I have to take out 10 ml of this drug. So I will take out 10 ml from this bottle, and the route of administration is IV. If IV is not available, because the veins are, in patients of cardiac arrest, veins are collapsed, so I can give medicines in deep veins, particularly in bones. We call it intraosseous route. So this is how we give adrenaline. Now there is one experiment of adrenaline which we discussed yesterday, vasomotor reversal of Dale, so that you read by yourself. Okay. So adrenaline ke dose we have discussed. The third doubt is of pralidoxime. Pralidoxime का role क्या है? Okay. So oximes we discussed yesterday. These starts with O, and these medicines are given for OP poisoning. These medicines are given for OP poisoning. We discussed yesterday. So what happens in OP poisoning? So what is the name of the enzyme? The name of the enzyme is acetylcholine esterase enzyme. Now this enzyme is occupied by organophosphate at esteric site. So there are two sites. One is known as anionic site. The second is known as esteric site of this enzyme. So organophosphates are present at esteric site, and therefore acetylcholine cannot bind with this site, and it cannot be metabolized. So acetylcholine level is increasing because acetylcholine metabolism is blocked because the enzyme is occupied by organophosphate. Now when I give oximes, now oximes are the drugs which contain positive charge. Oximes are the drugs which contain positive charge. So because of positive charge, these oximes will come and bind to the negative site. and after binding to the negative side, this positive charge will attract electrons of organophosphate. This will attract electrons of organophosphate, and when it will attract electrons of organophosphates, now this organophosphate cannot make the strong bond with esteric site, cannot make the strong bond with the esteric site, and therefore all organophosphate ions or electrons are used up with oximes. Now the bond which is formed between organophosphate and the esteric site is a weak bond, so body will break this bond. Body will break this bond after some time, and these two compounds are removed from here. And once these compounds are removed from here, now this enzyme is again reactivated for the metabolism of acetylcholine. So acetylcholine metabolism will again restart if you give oxime before the covalent bond formation, because once the covalent bonds are formed, then organophosphate will utilize all its electrons, all its free group, and after that if you give oxime, there is no rationale because all electrons are used up in that, right? ब्रोंकियल एस्थमा में फॉर्मेट्रोल आज की डेट में बेटर है instead of salbutamol, and the treatment of bronchial asthma today we will discuss in topic of respiratory system, right? So don't worry about bronchial asthma, you will come to know how to manage bronchial asthma. डोपामिन के डोज हमने डिस्कस किए थे yesterday so many times, right? So डोपामिन के डोज क्या हैं? डोपामिन is given in 3 type of dosing schedule: less than 2, 2 to 10 and more than 10. In dose less than 2 it will only act on D1, in 2 to 10 it will act on D1 and beta 1, in more than 10 it will act on D1, beta 1 as well as alpha 1, right? So discuss all these things yesterday. तो डोपामिन के डोज डिस्कस हो गए, एड्रेलिन के डोज डिस्कस हो गए. Phenylephrine. Phenylephrine is a drug that will cause mydriasis without cycloplasia. Phenylephrine is a medicine that will cause mydriasis without cycloplasia. No doctor, as a doctor, you people are not supposed to calculate the adrenaline dose. आप लोगों को नहीं मैन्युफैक्चर करना ना, ये यू पीपल आर नॉट इन मैन्युफैक्चरिंग, वी पीपल आर इन्वॉल्व इन मैन्युफैक्चरिंग. So as a pharma person, we have to prepare this solution. As a doctor, you have to just prescribe the drug. You need not to think how these preparations are made. You need not to think about that. You are a doctor, so you have to just write on a prescription. The nurse will follow your command, and we pharma people will make drug for you. Right? Phenylephrine will cause mydriasis. So we discussed yesterday iris muscle. If I talk about iris muscle is like a donut. Iris muscle is like a donut. The central gap is known as pupil. इसको बोलते हैं pupil. Now around this pupil, the muscle fibers are arranged like a wheel of a car, like a radial of a car. So these are the radial muscle fibers. So in iris muscle, the muscle fibers are arranged like a radial or the wheel of a car. So we have the presence of alpha 1 receptor over here. So whenever we stimulate alpha 1 receptor, this alpha 1 receptor will contract this muscle. And please remember, the outer end is fixed. The outer end of this muscle is fixed, but the medial end, the inner end of the muscle is mobile. So when this muscle will contract, assume करो ये muscle contract हो रहा है ऐसे. Look at here, the muscle is contracting like this. So when this muscle will contract like this way from all ends, the size of the pupil will increase, and this is known as mydriasis. The drug will cause mydriasis. Alpha methyl dopa has side effects. Alpha methyl dopa has side effects, but it is given in pregnancy. I mean, I didn't get the question, doctor. Drug cannot cross placenta, and because drug cannot cross placenta, it's safe for fetus. प्रेगनेंसी में सेफ्टी ना, फीटस की सेफ्टी की बात होती है. मदर को साइड इफेक्ट कर सकता है मेडिसिन कैन अफेक्ट द मदर, बट इट इज सेफ फॉर फीटस. दैट्स व्हाई वी कॉल दोज मेडिसिन्स आर सेफ इन प्रेगनेंसी. कार्डियोजेनिक शॉक का ड्रग ऑफ चॉइस है नॉर एड्रेनालिन. कार्डियोजेनिक शॉक ड्रग ऑफ चॉइस इज नॉर एड्रेनालिन, राइट? But we can also use other medicines like dopamine, So dopamine and dobutamine are other two medicines which we can also use for cardiogenic shock. But the best medicine is noradrenaline. Best medicine is noradrenaline, right? So covalent bond we have discussed already कि organophosphates जो हैं, if you will not remove organophosphates will form covalent bond here. Oximes will use their free electrons and covalent bond cannot be made. Okay, right? So we have discussed all this, right? Next is, okay, so role of alpha receptor on prostate. So doctor, this we will come to know today. Alpha receptor is present on prostate. It will increase the tone of prostate. It will increase the tone of prostate. It will increase the tone of prostate. By increasing the tone of prostate, it can stop the urine. It can increase the tone. It can stop the urine. Okay, let's start then. Vasomotor reversal of Dale. Doctor, we discussed yesterday vasomotor reversal of Dale. If you look at here, vasomotor reversal of Dale. Here it is. So we discussed that adrenaline is a drug which starts with alphabet A, and this medicine is agonist of all alpha and all beta receptor. So when I use adrenaline in low dose, this medicine will act only on beta 2 receptor of animal. This will only act on beta 2 receptor of animal because beta 2 receptor is most sensitive receptor of animal body, and this will cause vasodilation and hypotension. So beta 2 receptor stimulation can lead to hypotension as a manifestation. Now whenever I give high dose of adrenaline to this animal, after beta 2 receptor, this medicine will also start acting on alpha 1 receptor. Now when beta 2 receptor is activated and alpha 1 is also get activated, alpha 1 has a tendency to cause vasoconstriction, beta 2 has tendency to cause vasodilation. Now out of these two, please remember, alpha 1 receptor is always more in number. Alpha 1 receptor is always more in number than beta 2 receptor. So out of these two, when both receptors are stimulated, the alpha 1 effect dominates. When alpha 1 effect dominates, this will cause vasoconstriction and the BP will increase. Now this is the basic knowledge which you people already know. Now on the basis of this knowledge, we have done one experiment, and the experiment is we have blocked the alpha 1 receptor first of all. After blocking alpha 1 receptor, we have given high dose of adrenaline. And when I have given high dose of adrenaline after blocking the alpha receptor, now only the beta 2 receptor is stimulated. Only beta 2 receptor is stimulated because alpha 1 is blocked, and that will cause fall in blood pressure. This is known as vasomotor reversal of Dale. So very simple phenomena. There is nothing, no complication in this. Okay. So I think we have discussed all these poisonings, everything. So let's start with indirectly acting medicines. So indirectly acting medicines we were discussing yesterday when there was a disconnection. So indirectly acting medicines are those which are inhibitor of noradrenaline metabolism. If you remember, yesterday we discussed this point, how noradrenaline is metabolized. So we discussed that noradrenaline is released, and when this noradrenaline is released, 80% of this noradrenaline will be reuptaken back to the same nerve, go back to the same nerve, and then it is metabolized by MAO enzyme. Now what I am doing here, I am blocking this reuptake phenomena. I am blocking this reuptake of noradrenaline. So noradrenaline will stay here for long time, and if noradrenaline will stay here for long time, this will act on alpha beta receptor for long time. So I'm blocking this reuptake, and I'm also blocking this enzyme, the MAO enzyme. So noradrenaline metabolism is not possible. So noradrenaline level remain high, and it is keep on acting on alpha and beta receptor. This is the mechanism of action of indirectly acting medicines. So indirectly acting medicines, we discussed the mechanism of action yesterday also. These medicines are reuptake inhibitors, as well as these medicines are MAO inhibitors. Medicines will increase the level of noradrenaline, and now noradrenaline will act on receptors for a long time. Now, which medicines belong to this class? The first medicine which belong to this class is methylphenidate. Medicine का नाम है methylphenidate, and please remember this methylphenidate, by increasing the level of noradrenaline in CNS, by increasing the level of noradrenaline in CNS, this medicine can improve the attention span of the patient. This medicine can improve the attention span of the patient, and by increasing the attention span or by improving the attention span of the patient, this medicine is considered as drug of choice for attention deficit hyperactive disorder. Medicine is drug of choice for attention deficit hyperactive disorder. So we also call it ADHD, in short, attention deficit hyperactive disorder. So medicine is methylphenidate. So students mostly remember like this way: if you want to go on date with someone, give attention to that person. So just remember two words: if you want to go on date with someone, give attention to that person. So if you give attention, you can get an opportunity to go on date. So methylphenidate is a drug. It's a best medicine for attention deficit hyperactive disorder. So attention deficit hyperactive disorder, we use this medicine methylphenidate. Now we have one more drug, modafinil. Now modafinil is a drug which will also increase the level of noradrenaline in CNS, and because of this reason, this medicine can activate the CNS, keep the CNS active all the time, and therefore this will reduce the sleeping time. This will reduce the sleeping time of the patient, and this medicine is considered as drug of choice for excessive sleeping disorder, that is known as narcolepsy. It is drug of choice for narcolepsy. Excessive sleeping disorder, the disorder is known as narcolepsy. Modafinil is drug of choice. So narcolepsy is a disorder where patient will suffer from a deficiency of a chemical in brain. The name of the chemical is orexin. So name of the chemical is orexin, which is deficient in your brain, and this chemical keeps you active all the time. Orexin is a chemical which keeps you active, and when this orexin is not there, you always remain sleepy. So modafinil is the drug which will keep your CNS active. It's a best medicine for the treatment of narcolepsy. Right? Now I don't have any mnemonic for this, but there are some regional language mnemonics. For example, if you are Gujarati, I hope some of you are Gujarati, right? So moda means when you are getting late. So when you are getting late, we call it moda. So moda nil. So when you take this medicine, you will not get late in your life. So moda means late in Gujarati, and moda is now nil. So you will not get late in your life if you take this medicine modafinil. So modafinil is a medicine which will not let you late in your life. The drug is modafinil. And if you are Telugu people, you must be knowing the Telugu language. Moda means what? And after that you can make any mnemonic, right? So moda means you already know in Telugu, and after that mnemonic can be made. And if you can make some mnemonic in English, please send it to me. Yesterday you people sent me very good mnemonics for those medicines. So I expect you to send some mnemonic of modafinil also. Next is amphetamine. Amphetamine is a drug which is also known as kick. The third medicine which is indirectly acting drug, amphetamine, right? So this medicine is also known as kick. And we have one more drug, MDMA. So MDMA is also a kind of amphetamine. It's a more active amphetamine. We call it methylamphetamine. So this MDMA is also known as methylamphetamine drug. So amphetamine and methylamphetamine. This methylamphetamine is known as ecstasy. Methylamphetamine is known as ecstasy. So amphetamine and methylamphetamine, that is ecstasy, these medicines will keep your CNS active all the time. So we can use these medicines during the party. So during the party, people use this medicine. So these parties where illegal drugs are used to keep your CNS active, known as rave parties, and medicines which are used in rave parties are known as rave drugs. So these medicines are known as party drugs or rave drugs. So these medicines are known as rave drugs and party drugs. So these medicines are misused. Basically, these medicines are abusive drugs, right? Right? So rave drugs, rave parties, ecstasy, right? So ecstasy and kick are two medicines which will keep your CNS active. So medicines are rave drugs and party drugs. Now we have the scorpion toxin. If we talk about scorpion toxin, now whenever patient is bitten by Scorpio, this will also result in excessive norepinephrine in your body. So this norepinephrine will act on alpha 1 receptor, can result in vasoconstriction, and result in hypertensive crisis. So patient is bitten by Scorpio and this can result in hypertensive crisis. This is a manifestation of scorpion sting. Now please remember there are some food products which contains tyramine. So tyramine is a chemical compound which is present in food products like cheese and fava beans. So there are some food products like cheese and fava beans where we have this tyramine. So whenever people consume this tyramine containing food, then again lot of noradrenaline is released. In their body, right? And if the person is also taking MAO inhibitor, if that person is also taking MAO inhibitor, then noradrenaline metabolism is also blocked. So noradrenaline metabolism is also blocked because patient is taking MAO inhibitors. So MAO inhibitor is a group of medicines which we use for depression actually. So MAO inhibitor is a group of medicines which we use for depression. So if the MAO enzyme is blocked, and noradrenaline level becomes high because of consuming tyramine containing food, now this will also result in hypertensive crisis. And this hypertensive crisis is known as cheese reaction. Now what is cheese reaction? Cheese reaction is nothing, just a hypertensive crisis. It is just a hypertensive crisis that occurs when you consume two things together. So when you take two things together, number one, tyramine containing food plus MAO inhibitors. So if you consume tyramine containing food, along with MAO inhibitor, this will cause hypertensive crisis and cheese reaction. This is all about indirectly acting medicine, which I wanted to complete yesterday, but because of technical glitch, I couldn't, right? So one student has sent me a mnemonic for this, Dr. Anish Kumar. Anish Kumar ने sent किया है कि मोडाफिनिल में ऐसे याद रखो कि मोडाफिनिल is having the final. So फिनिल से याद रखो final. So before your final exam, you have to take this medicine, that is modafinil. So before the final exam, you have to take this modafinil because modafinil keep you active one night before. So before the final exam, take modafinil to keep yourself active so that you can perform better. Right? So modafinil is for final exam. Thanks, Dr. Anish Kumar. We are lucky to have student like you. He is from Punjab. So anti-adrenergic drug. Let's start with next topic, anti-adrenergic drugs. So anti-adrenergic drugs are blocker of alpha receptor. We call them alpha blocker, or we have beta blockers. We have two types of medicines which are anti-adrenergic drugs, alpha blockers and beta blockers. So let's start with first topic, the medicines which are known as alpha blockers. So if we talk about alpha blockers can be of two types, specific alpha blockers and non-specific alpha blockers. So non-specific alpha blockers are blocker of both alpha 1 as well as alpha 2, and specific blockers are again two types, medicines which are blocker of alpha 1 or medicines which are blocker of only alpha 1A. So medicines which are blocker of alpha 1 or medicines which are blocker of alpha 1A. Now before starting with this discussion of alpha blocker, yesterday's discussion you people must be knowing there are 4 locations of alpha receptor. So if I ask you this question, what are the 4 locations of alpha receptor? The mnemonic is probes. There are 4 locations of alpha receptor. Number 1, prostate. Number 2, blood vessels. E stands for radial muscle of eyes and S stands for sphincter. So prostate, blood vessels, eyes and sphincters are 4 important locations. 4 important locations of alpha receptor, right? Now please remember, this alpha receptor we can further subclassified in 2 groups. This alpha receptor further subclassified in 2 groups. One is known as alpha 1A, second is known as alpha 1B. Alpha 1 receptor further subclassified in 2 subgroups, alpha 1A and alpha 1B. Now please remember, everywhere we have alpha 1A receptor in human body. Everywhere we have alpha 1A receptor in human body, but only on blood vessels. Only on blood vessels we have alpha 1B. And it is very easy to recognize because B stands for blood vessels and on blood vessels we have alpha 1B. So on blood vessels we have alpha 1B and rest everywhere we have alpha 1A. Right? So probes is a mnemonic. In this mnemonic of probes, pro stands for prostate, B stands for blood vessels, E stands for eyes, S stands for sphincters, and everywhere we have alpha 1A, but only on blood vessels we have alpha 1B. Now let's start with medicines which are specific alpha receptor blocker. So the first group of medicine is medicines which are blocker of alpha 1 receptor. Medicines which are blocker of alpha 1 receptor, the first topic is alpha 1 receptor blocker. Medicines which are blocker of alpha 1 receptor. So these medicines which are blocker of alpha 1 receptor as a complete receptor, this will inhibit alpha 1A as well as alpha 1B both. Now by inhibiting alpha 1B, these medicines can cause vasodilation. And because of vasodilation, medicines can reduce the blood pressure. Medicine can reduce the blood pressure. So these medicines are mainly given for the treatment of those conditions wherever you want to reduce the blood pressure. So medicines names are terazosin, elfuzosin, prazosin. Out of these 3, this prazosin is important for your exam. Rest of the 2 names are not important. So medicines are prazosin, elfuzosin, terazosin are some names which are there. So these medicines are given to reduce the blood pressure. So where do we use this medicine? So these medicines are given for the treatment of hypertension. Medicines are given for the treatment of hypertension. Plus these medicines are drug of choice for hypertensive crisis. Medicines are drug of choice for hypertensive crisis associated with scorpion sting. So associated with scorpion sting or scorpion bite. So hypertensive crisis that is associated with scorpion sting. Please remember, prazosin is a medicine which is drug of choice. So prazosin is a medicine which is drug of choice for hypertensive crisis associated with scorpion sting. So hypertensive crisis associated with scorpion sting, we can use this medicine prazosin, right? Now apart from that, these medicines can also relax the prostate capsule. These medicines can also relax the prostate capsule, and because this medicine can relax the prostate as well as urinary sphincter. Medicines can relax the prostate as well as urinary sphincter, and by relaxing the prostate as well as urinary sphincter, these medicines can also be given for the treatment of BPH. Medicines are given for the treatment of BPH also. So relax the prostate gland, relax the urinary sphincter. Medicine is given for the treatment of BPH, that is benign prostate hyperplasia. The drug which is mostly given for this purpose is elfuzosin. So elfuzosin is a medicine of this group that is given for the treatment of BPH, that is benign prostate hyperplasia. So medicines are given for hypertension. Medicine is given for hypertension crisis associated with scorpion sting, and also given to relax prostate and sphincter. The drug name is elfuzosin. So 3 medicines, which 3 indications where we use alpha blockers. Now there is one very big problem with this alpha blockers. Now what is the problem with alpha blockers? The problem with alpha blocker is these medicines can cause orthostatic hypotension as a side effect. So medicine side effect is hypotension, and this hypotension is very commonly seen whenever patient will change the posture. So whenever patient will change the posture, this hypotension is very commonly seen. So we call it postural hypotension and orthostatic hypotension. So this is known as postural hypotension and orthostatic hypotension. So medicine can cause side effect as hypotension, and this hypotension is commonly seen whenever patient change the posture. So whenever patient will change the posture, this hypotension is very commonly seen. So it is known as postural hypotension and orthostatic hypotension as a side effect. So orthostatic hypotension, postural hypotension as a side effect of this medicine due to this reason, right? Now this side effect is very commonly seen in first 2 to 3 days of therapy. So this side effect of hypotension is common in first 2 to 3 days of therapy. So first 2 to 3 days of therapy, this side effect is more common. So this side effect is also known as first dose phenomena. This side effect is also known as first dose phenomena. So side effect is known as first dose phenomena. This is common in first 2 to 3 days of therapy. We call it orthostatic hypotension and postural hypotension. Orthostatic hypotension, postural hypotension, the side effect of this medicine, right? Second is medicines which are specific blocker of only alpha 1A. Medicines which are blocker of only alpha 1A. So these medicines will not cause any vasodilation. Medicine will not cause any vasodilation because there is no effect on alpha 1B. So alpha 1B receptor is present on blood vessel. So medicines will not block this alpha 1B, so there is no vasodilation. Medicines are only blocker of alpha 1A receptor. And by blocking this alpha 1A receptor, medicines will relax the prostate and sphincter. Medicine can relax the prostate and urinary sphincter. Medicine can relax the prostate and urinary sphincter, but will not cause any vasodilation. So there is no risk of any orthostatic hypotension. So there is no risk of any hypotension as a side effect. So medicines are considered as drug of choice. Medicines are considered as drug of choice for BPH. These medicines are considered as drug of choice for BPH. Medicines are tamsulosin and silodosin. So tamsulosin, silodosin are two medicines which are the best medicines for BPH. Now what are the side effects of tamsulosin, silodosin? Now although these medicines will not cause hypotension because of no effect on blood vessels, but medicine will act on radial muscle of iris. So these medicines will paralyze radial muscle of iris. So alpha 1 receptor can contract radial muscle of iris. Now radial muscle of iris cannot be contracted. And because radial muscle of iris cannot be contracted, right? So this medicines can cause meiosis as a side effect. This medicine can cause meiosis as a side effect. And if the patient will undergo cataract surgery, after taking this medicine, so after taking the medicine, if the patient will undergo cataract surgery, then iris will have abnormal movements, abnormal contraction and relaxation during cataract surgery. This is known as floppy iris syndrome. So medicine have effect on iris. Iris and the pupil will go in miotic state. So this iris has abnormal movements during cataract surgery. So after taking the medicine, if the patient will undergo cataract surgery, I hope you know this point, these patients are mostly old patients. Patients of BPH are mostly old patients and they have cataract very commonly. And because of this common side effect, because of this common problem of cataract, if they will undergo cataract surgery, after taking this medicine, then during the cataract surgery, this iris muscle will have abnormal contraction. This is known as floppy iris syndrome as a side effect. Now please remember, when we block this alpha receptor, then the sphincter is relaxed, and when this sphincter is relaxed, the semen in the male patient can go backwards. So mostly whenever patient will have ejaculation, the semen will always come anterograde, right? In this case, the semen can go backwards because the sphincter cannot control the backward movement of the semen. So this is known as retrograde ejaculation. This is known as retrograde ejaculation. So medicines will relax the sphincter. This is known as retrograde ejaculation as a side effect. So semen can go backwards because the sphincter is loose. So all penile sphincter, urethral sphincter, as well as these sphincters are loose, and so the semen can go backwards in bladder. So retrograde ejaculation. That is all about tamsulosin and silodosin as a drug, which are the best medicine for BPH, but can lead to two main problems. One is floppy iris syndrome. Second is retrograde ejaculation. Right? The other medicines which are mainly blocker of alpha-1 receptor like prazosin, these medicines have a big problem of hypotension. So medicines can cause hypotension as a big issue, and this hypotension is more common when the patient will change the posture. So we call it orthostatic or the postural hypotension, and the phenomena is known as first dose phenomena. That is all about these medicines. Now let's talk about non-specific alpha blockers. So if we talk about non-specific alpha blockers, medicines which are non-specific alpha blockers. Now we have two types of non-specific alpha blockers. One is reversible blocker, second is irreversible blocker. First is reversible blocker of alpha receptor, second is irreversible blocker of alpha receptor. And we discussed yesterday, what does it mean by irreversible block? Irreversible block means medicine will form which type of bond? Answer is covalent bond. Irreversible block means medicine will form covalent bond. Reversible block means medicine will form ionic bond. So there are some medicines which will produce irreversible block at alpha receptor by making covalent bond. And because the block is irreversible, medicine action lasts for long time. But for the reversible drug, the bond is ionic, which is comparatively weaker. So the medicine action lasts for short duration. Now the medicine which belongs to this class of irreversible blocker, the medicine name is phentolamine. Sorry, please make a correction. The drug name is phenoxybenzamine. So phenoxybenzamine is a drug which is irreversible blocker. And the reversible blocker, the drug name is phentolamine. So reversible blocker is phentolamine and irreversible blocker is phenoxybenzamine. Now please remember, phenoxybenzamine is drug of choice for hypertensive crisis. It is the drug of choice for hypertensive crisis associated with pheochromocytoma. Hypertensive crisis associated with pheochromocytoma. So hypertensive crisis associated with pheochromocytoma, phenoxybenzamine is drug of choice for that. So phenoxybenzamine, drug of choice for hypertensive crisis associated with pheochromocytoma. But if I talk about phentolamine, phentolamine is drug of choice for hypertensive crisis associated with cheese reaction. So hypertensive crisis associated with cheese reaction, phentolamine is a drug of choice, and hypertensive crisis associated with pheochromocytoma, phenoxybenzamine is drug of choice. So phenoxybenzamine, drug of choice for hypertensive crisis with pheochromocytoma, and phentolamine, drug of choice for hypertensive crisis associated with cheese reaction. Right? So please make a mnemonic for this, like students make a mnemonic like this way. This phenoxybenzamine is a drug which contains a word ban. So this medicine contains a word ban. So this medicine will ban the cancer. This medicine will ban the cancer, that is pheochromocytoma. So this medicine will ban the cancer, pheochromocytoma. The drug is phenoxybenzamine. So phenoxybenzamine is a drug. This medicine will ban the cancer, pheochromocytoma. And for phentolamine, students make the mnemonic that cheese and Fanta. Fanta is the name of a soft drink. So cheese and Fanta should always be consumed together. So cheese and Fanta should always be consumed together. So phentolamine is drug of choice for cheese reaction. So phentolamine is drug of choice for cheese reaction. So please remember, Fanta and cheese should always be consumed together. And phenoxybenzamine having the word ban, so this medicine will ban the tumor. So ban medicine will ban the tumor, and Fanta will consume with cheese. Tamsulosin, drug of choice for BPH. Tamsulosin, drug of choice for BPH, and prazosin is drug of choice for hypertensive crisis associated with scorpion sting. So hypertensive crisis associated with scorpion sting, prazosin is drug of choice for that. So that is all about alpha blockers. So guys, try to understand. Alpha blockers में ना आपको mainly concentrate करना है only on 4 medicines. There are 3 medicines which starts with the word P. First medicine is prazosin. It's a drug of choice for scorpion sting. The first medicine starts with P is prazosin. The second medicine starts with P is phentolamine. It's a drug of choice for cheese reaction. The third is phenoxybenzamine. It's a drug of choice for pheochromocytoma. So all 3 medicines starts with alphabet P. Now after that 3P, there is one drug tamsulosin. So it's a drug of choice for BPH. तो पूरे अल्फा ब्लॉकर में there are total 4 medicines. 3 medicines starts with P, 1 medicine starts with T, tamsulosin. So tamsulosin के side effects are important: floppy iris syndrome and retrograde ejaculation. Floppy iris syndrome and retrograde ejaculation. And prazosin side effect is orthostatic and postural hypotension. That is all about alpha blockers. Now let's talk about beta blockers. Next topic is beta blocker. So if we talk about this topic, beta blockers. Now beta blockers are of 3 types. There are 3 types of beta blocker: generation 1, generation 2 and generation 3. We have 3 types of beta blocker: generation 1, generation 2 and generation 3. Right? Now if we talk about generation 1 beta blocker, generation 1 beta blockers are non-selective beta blockers. Generation 1 beta blockers are non-selective beta blockers. These medicines block both beta 1 and beta 2 receptor. They are the non-selective beta blockers. These medicines can block both beta 1 and beta 2 receptor. So non-selective beta blockers, these medicines can block both beta 1 as well as beta 2 receptor. And because these medicines block beta 2 receptor, we discussed already that beta 2 receptor normally causes vasodilation. Now if I block this beta 2 receptor, this will result in vasoconstriction. So by blocking beta 2 receptor normally causes relaxation of smooth muscle, normally result in relaxation of smooth muscles. But by blocking beta 2 receptor, this will cause vasoconstriction. This will cause vasoconstriction. Guys, give me 1 minute. I have to receive a phone call. Right. So we were discussing about beta blockers. There are 3 generations of beta blocker: generation 1, generation 2, generation 3. Generation 1 medicine is the oldest group. So obviously this is non-selective, and generation 2 medicines are selective beta blockers. So non-selective medicines are blocker of both beta 1 and beta 2 receptor. And because medicines block beta 2 receptor which normally relax the smooth muscles will now contract the smooth muscle. When you block this beta 2 receptor normally relax the smooth muscle. Now you are blocking this beta 2, so this will result in contraction of smooth muscle. So blood vessels get constricted. So this medicine can cause contraction of blood vessels. So vasoconstriction is important side effect. Now similarly, when the blood vessels are contracted in a similar manner, bronchioles are also contracted. So by blocking beta 2 receptor, these medicines can lead to 2 important side effects. Number 1 is vasoconstriction. Number 2 is bronchoconstriction. So medicine can cause vasoconstriction as well as bronchoconstriction as a side effect. Now because of this vasoconstriction and bronchoconstriction as a side effect, these medicines are contraindicated. These medicines are contraindicated in some conditions where you do not require vasoconstriction and bronchoconstriction. Now, what are the contraindication? For example, these medicines should not be given to a patient of COPD and bronchial asthma. So, in patients of bronchial asthma and COPD, these medicines are contraindicated. So, C/I stands for contraindication. Medicines can cause bronchoconstriction. Medicines should not be given to a patient of bronchial asthma and COPD. And because medicines can cause vasoconstriction, we should avoid giving these medicines to a patient of hypertensive crisis. We should avoid giving these medicines in patients of hypertensive crisis. We should avoid giving these medicines in patients of peripheral vascular disease. We should not use these medicines in patients of peripheral vascular disease like Raynaud's disease and Burgess disease. So in patients of Raynaud's disease and Burgess disease, we call them peripheral vascular disease. We should avoid using the medicine because in peripheral vascular disease, already there is vasoconstriction. Already there is presence of vasoconstriction. So we should avoid using this medicine in patients of peripheral vascular disease. So bronchial asthma, COPD, hypertensive crisis. In patients of peripheral vascular disease, medicines are contraindicated, as well as these medicines are contraindicated in those patients who are suffering from coronary artery disease. So patients suffering from coronary artery disease, for example, if a patient is suffering from myocardial infarction or patient is suffering from vasospastic angina. So patient suffering from vasospastic angina, patients suffering from vasospastic angina or myocardial infarction, these are known as coronary artery disease. So in patients of coronary artery disease like myocardial infarction or vasospastic angina, where the blood vessels of heart are already in a constriction phase, so medicines are contraindicated. So blood vessels are already blocked, blood vessels are already in spasm, so these medicines are contraindicated in such type of patients where the problem of blood vessel contraction is already present. So medicines are contraindicated in patients of bronchial asthma and COPD, hypertensive crisis, peripheral vascular disease, as well as coronary artery disease. Now let's talk about generation 2 medicines. If we talk about generation 2 medicines, again, one thing is left, the names of these medicines. What are the names of generation 1 medicines? The names of generation 1 medicines are propranolol, timolol, nadolol, sotalol. Propranolol, nadolol, sotalol, timolol are 4 names. So some students make the mnemonic like this way. They make the mnemonic like this: proper, non-selective, tim. So proper, non-selective timolol, they make the mnemonic. So proper is for propranolol. So these are the propranolol. Non is for nadolol, selective is for sotalol, and tim is for timolol. Or some students make the mnemonic like this way. They make the mnemonic like protein shake. They will make the mnemonic protein shake. So the mnemonic is protein shake. In this mnemonic of protein shake, pro stands for propranolol, T stands for timolol, N stands for nadolol, and shake is for sotalol. So protein shake. Propranolol, timolol, nadolol, sotalol. Propranolol, timolol, nadolol, sotalol, protein shake. Or second mnemonic is proper non-selective timolol. Now we have some generation 2 medicines. Now generation 2 medicines are only blocker of beta 1 receptor. These medicines are only blocker of beta 1 receptor. So we also call them cardioselective beta blockers. We know that one of the important location of beta 1 receptor is heart. So beta 1 receptor has 4 locations. We discussed already yesterday. One of the location of beta 1 receptor is heart, and medicines are specific blocker of beta 1 receptor. So we call them cardioselective beta blockers. We also call them cardioselective beta blockers, and the medicines which belong to this class, the mnemonic is BEAM. So medicines names are betaxolol. So if you look at the name betaxolol, the name starts with word beta. So it's a betaxolol. E stands for ismolol, A stands for etinolol, and M stands for metoprolol. So betaxolol, ismolol, etinolol, metoprolol are 4 medicines which are generation 2 medicines, cardioselective medicines. Right? So 4 medicines are cardioselective, 4 medicines are non-selective. Now we have generation 3 medicines also. Now generation 3 medicines are special beta blockers which have the property to cause vasodilation. So generation 3 beta blockers are those beta blockers which can cause vasodilation. Now which medicines are generation 3 beta blocker? The first name is labetalol. Now please remember, labetalol is a beta blocker. Labetalol is a beta blocker which can also block alpha receptor. So this medicine is beta blocker but also block alpha receptor, and by blocking alpha receptor this medicine can cause vasodilation. This medicine can cause vasodilation. So labetalol is a generation 3 beta blocker. Number 2, there is a drug nebivolol. So nebivolol is a beta blocker. Nebivolol is a beta blocker which can donate nitric oxide. So this can donate nitric oxide. So this will donate nitric oxide, and because of nitric oxide this will cause vasodilation. Because of nitric oxide this will cause vasodilation. And the third is carvedilol. The third one is carvedilol. The carvedilol is a beta blocker. Carvedilol is a beta blocker which also block alpha receptor. This medicine also block calcium channel, and this medicine also has antioxidant property. This medicine also has antioxidant property. So there are 4 properties of this medicine. So students, remember like this way. Carvedilol starts with the word car. Carvedilol starts with the word car, and car has 4 wheels. Car has 4 wheels, so this medicine has 4 properties. This medicine has 4 properties like the car has 4 wheels, and these properties are A, B, C. So these properties are A, B, C, where A stands for antioxidant effect, A stands for alpha blocker, B stands for beta blocker, C stands for calcium blocker. So A is for alpha blocker, B is for beta blocker, C is for calcium blocker, and next A is for antioxidant. So car has 4 wheels, medicine has 4 properties: alpha blocker, beta blocker, calcium blocker, ABC, and one more A is for antioxidant. Now nebivolol starts with N. Nebivolol starts with N. This can donate nitric oxide. Nebivolol starts with N. This will donate nitric oxide. It's easy to memorize. And if we talk about labetalol, labetalol is a drug which has the letters A and B. So it has the letters A and B. So it's alpha blocker and beta blocker both. So A and B stands for it's a alpha as well as beta blocker. So all these 3 medicines will cause vasodilation. So labetalol, nebivolol, carvedilol, all 3 medicines are generation 3 beta blocker and have vasodilator property. So generation 1 medicines, mnemonic is protein shake, propranolol, timolol, nadolol, and sotalol. Or you can make the mnemonic proper non-selective drugs. So proper non-selective drugs are propranolol, nadolol, sotalol. So proper non-selective medicines are propranolol, nadolol, sotalol. And selective beta blockers are generation 2. We call them BEAM, betoxolol, ismolol, atenolol, and metoprolol. We also call them cardioselective beta blockers. We also call them cardioselective beta blockers. Generation 3 medicines have vasodilator property, we have discussed already. Now where do we use these medicines? So indications. So very simple rule is, please remember one very simple rule for indications. Generation 1 medicines are useful for non-cardiovascular indications. So generation 1 medicines are given for non-cardiovascular indication. They are avoided in cardiovascular problems. So because of their vasoconstricting property, they are avoided in cardiovascular indications. Generation 1 medicines are mainly given for non-cardiovascular indication, but generation 2 and 3 are the first line drugs for cardiovascular indications. So generation 2 and 3 are first line drugs for cardiovascular indications, but generation 1 medicines are avoided in cardiovascular indications. So this is the main difference in their indications. For example, if we talk about hypertension, now hypertension is a cardiovascular problem. So we only use generation 2 and generation 3 medicines here. So only generation 2 and generation 3 medicines are used here. So only generation 2 and generation 3 medicines we use for hypertension. We do not use generation 1 medicines. So we know that blood pressure is equal to cardiac output into peripheral resistance. Blood pressure is equal to cardiac output multiplied by peripheral resistance. So whenever we block beta 1 receptor, then the heart contractions are reduced. Whenever we block beta 1 receptor, the contraction of heart is reduced. And when the contraction of heart is reduced, this will reduce the cardiac output. And when this will reduce the cardiac output, the BP will fall. So BP will fall. So beta blockers are given to reduce the blood pressure. Beta blockers are given to reduce the blood pressure by blocking the beta 1 receptor. So by blocking the beta 1 receptor, the heart is inhibited, cardiac output will fall, and this will reduce the blood pressure. Now out of these two, labetalol and esmolol, please remember, labetalol is a medicine, it's a drug of choice for PIH. Labetalol is a medicine, it's a best medicine for treatment of pregnancy-induced hypertension. It is the best medicine for pregnancy-induced hypertension, whether the female requires maintenance treatment or she is in crisis. So whether she is in crisis or requires maintenance treatment, drug of choice or the best medicine for PIH is labetalol. And if we talk about esmolol, esmolol is drug of choice for hypertension crisis associated with aortic dissection. So hypertension crisis associated with aortic dissection, esmolol is the best medicine to give. So hypertension crisis with aortic dissection, we give esmolol, but for PIH we give labetalol. So labetalol is the best medicine for PIH. Very, very important question for your exam. Labetalol is the best medicine for PIH. Whether it's a maintenance treatment or it's a crisis, labetalol is always a best medicine to start. Now esmolol is a drug which is the best for aortic dissection with hypertension crisis. Now second is angina. So angina is again a cardiovascular indication. So we use only generation 2 and generation 3 medicines. So medicines which are beta blockers, by blocking the beta receptor, these medicines will decrease cardiac output and therefore reduce the force of contraction, right? So these medicines reduce the force of contraction, reduce the heart rate. These medicines reduce the force of contraction as well as reduce the heart rate and therefore reduce the oxygen demand of the heart. So by blocking the beta 1 receptor, medicines can decrease the cardiac output, reduce the heart rate, reduce the force of contraction and therefore reduce the oxygen demand of the heart. And when medicine will reduce the oxygen demand of the heart, these medicines are given for the treatment of angina. Medicine are given for the treatment of angina because angina is a condition where patient oxygen demand is very high. Oxygen demand of the heart is high and that cannot be fulfilled. So medicines are beta blocker, generation 2, generation 3 medicines. By blocking beta receptor, they have the inhibitory effect on heart, reduce the heart rate, reduce the force of contraction and therefore reduce the oxygen demand of heart muscles, and medicines are given for angina. And we discussed already, generation 1 medicines should be avoided in patients of cardiovascular condition like vasospastic angina. So generation 1 medicines are contraindicated, but generation 2, generation 3 medicines are used. Third indication, beta blockers are also given for the treatment of arrhythmias. So whenever we block beta receptor, this will inhibit the nodes of the heart, inhibit the heart rate, reduce the heart rate, inhibit the nodal activity, and these medicines are given for the treatment of supraventricular type of arrhythmias. So beta blockers are given for the treatment of supraventricular type of arrhythmias. Guys, please remember, we have two types of arrhythmias. One is known as ventricular type, second is known as supraventricular type. So any arrhythmia that start above the ventricle, any arrhythmia that starts above the ventricle is known as supraventricular type, and any arrhythmia that starts in ventricle muscle itself, we call it ventricular type of arrhythmia. So supraventricular arrhythmia is arrhythmia that starts above the ventricle, later on shifted to ventricle. Starts above the ventricle, but later on shifted to downwards, that is ventricle. But ventricle arrhythmias are those that will start itself in ventricle muscles. So beta blockers are anti-arrhythmic drugs. Beta blockers are anti-arrhythmic drugs. These medicines are given to inhibit the nodal activity and reduce the heart rate. And we know that the nodes are always present above the ventricle. SA node, AV node always present above the ventricle. So these medicines are given for the treatment of supraventricular type of arrhythmias. Number 4 indications, these medicines are also given for the treatment of CHF. So beta blockers are given for the treatment of CHF. Now in treatment of CHF, please remember, patient can come to you with acute CHF. We call it acute decompensated heart failure. So patient can come to you with acute decompensated heart failure. Now what is acute decompensated heart failure? Acute decompensated heart failure means patient ejection fraction is very low. Patient ejection fraction is very low. It is less than 35 to 40, or we can say that the patient is in shock. So we can say that because of acute CHF, patient is in shock, and this shock is cardiogenic shock. So we'll say that the patient is in cardiogenic shock due to the decompensated heart failure. So in this case, ejection fraction is already very low, and if we give beta blockers, beta blockers will further reduce the cardiac output. Beta blockers will further reduce this ejection fraction. So beta blockers are contraindicated. Beta blockers are contraindicated in patients of decompensated heart failure. But in patients of compensated heart failure, where ejection fraction is approximately 55%, which is approximately equal to the normal value. In compensated heart failure, when the ejection fraction is approximately same as the normal value, now in this case, beta blockers are the first line drugs. So in this compensated heart failure, beta blockers are given as first line drugs, especially the generation 2, generation 3 medicines given as first line drugs. Now why we use these medicines in compensated heart failure? Please remember, look at here. So in patients of congestive heart failure or compensated heart failure, the cardiac output is always less than the normal. Cardiac output is always less than the normal value. So the normal value is 60. Now here it is 55. And because of this less than the normal value, kidney blood flow is always less. So RBF stands for kidney blood flow. So if your cardiac output is low, your kidney will always get less blood supply. And when kidney will get less blood supply, kidney will activate one pathway. That pathway is known as RAS pathway. So kidney will activate one pathway. We call it RAS pathway through the JG cells. So kidney will activate RAS pathway through its JG cells. Right? Any idea what is full form of RAS pathway? Anyone of you? Have you covered RAS pathway in any other subject like biochemistry or pathology? Anyone who is there online can answer this question. What is RAS pathway? Very good. This is known as renin-angiotensin system. Yes, it is renin-angiotensin system. Right. Yes, okay, fine. So it's a renin-angiotensin-aldosterone system. Right? So please remember, in patients of heart failure, cardiac output is always less than the normal. That's why the condition is known as heart failure. If it is normal, we'll not call it heart failure, right? So it is always less than the normal. And because this cardiac output is less than the normal, kidney will get less blood supply. So renal blood flow, RBF full form is renal blood flow. So renal blood flow is always low, and when this kidney blood flow is always low, kidney will sense that patient is suffering from dehydration. Kidney को लगेगा कि patient की body में water deficiency है. Kidney will think that patient suffer from dehydration, and therefore now kidney wants to retain more water for the body. And when kidney wants to retain more water from the body, kidney will activate the renin-angiotensin system, and that includes one hormone also. We call it aldosterone. So aldosterone hormone is secreted out. Now this aldosterone hormone will retain sodium and water for the body. So aldosterone will retain sodium and water for the body. So that's fine. So this aldosterone retains sodium and water for the body. It's fine. But side by side, this aldosterone will also do one more thing. Aldosterone will act on heart muscles and change the structure of heart muscles. Aldosterone will act on heart muscles and change the structure of heart muscle. So this aldosterone will result in hypertrophy of cardiac muscles. So why aldosterone will do the hypertrophy of cardiac muscle? Because now aldosterone wants, or the renin-angiotensin system wants, कि heart muscles will have the more muscle mass, and therefore heart muscles can contract more forcefully. So heart muscles, if contract more forcefully, the kidney will get normal blood supply. So kidney को लगा कि blood supply is less, and why this blood supply is less? There are two reasons. If the kidney is getting less blood supply, there are two reasons for that. Number one, kidney को लगता है patient is suffering from dehydration. So kidney, with the help of RAS pathway, will try to retain sodium and water. Second, kidney को लगता है कि maybe the heart is not pumping the blood. That's why all organs are getting less blood supply. So what this kidney will do? Kidney will make the heart muscles hypertrophied so that the heart can pump more forcefully. But the unfortunate thing is, like if this is the heart, when kidney will do muscle hypertrophy, when the RAS pathway will do muscle hypertrophy, this muscle hypertrophy will take place towards the inner side of ventricle chamber. This muscle hypertrophy will take place towards the inner side of heart chamber, and when this hypertrophy will take place towards the inner side of heart chamber, now look at this red color, the heart chamber size, the volume of this left ventricle is keep on declining. The muscle mass is very high, the muscles are very hypertrophied, but look at the chamber volume. The chamber volume is now very, very less. So end diastolic volume, the volume of the blood which normally accumulate in the heart, is now reduced. And when this volume is reduced, does not matter how strongly the muscles will contract, the cardiac output is keep on declining. So cardiac output is reduced. So cardiac output is reduced due to this abnormal muscle mass at hypertrophy. So abnormal muscle mass hypertrophy will take place towards the inner side. So this hypertrophy will take place towards the concentric side. We call it concentric hypertrophy. Concentric means inner side. So this hypertrophy will take place towards the inner side, and that will ultimately cause reduced cardiac output. So initially this hypertrophy is required by the kidney to increase the blood flow. But क्या होता है gradually कि when this process will continue, this hypertrophy becomes abnormal. This hypertrophy becomes abnormal and ultimately reduce the chamber volume and reduce the cardiac output, and this cycle will again start. So when the cardiac output is reduced, kidney will get further reduction of blood supply. Kidney will activate more RAS. More RAS means more hypertrophy. More hypertrophy means further reduction of cardiac output. So in this way, patient cardiac output is keep on declining, and therefore patient will die due to this heart failure. So this is known as remodeling. We call this process as cardiac remodeling. So in patients of heart failure, the day the disease is diagnosed, the day the heart failure is diagnosed, patient will have the cycle started, the cycle of RAS pathway started, and this cycle has a tendency to cause cardiac remodeling. Right? तो cardiac remodeling का risk है. Initially तो this hypertrophy we required so that heart can pump more blood, but gradually क्या होगा? This hypertrophy becomes pathological. And when this hypertrophy becomes pathological, that the cutoff time limit is not known. ऐसा कहते हैं ना कि वो मेरी जिंदगी में आया, मुझे अच्छा लगा, बट कब उससे प्यार हो गया पता ही नहीं लगा. Same here. This hypertrophy, when it started, it was good, it was required, but when it becomes pathological, ये नहीं पता. And that's why we cannot manage this hypertrophy, we cannot reverse this hypertrophy. So what we have to do, we have to prevent. हमें day 1 से ही precautions लेने हैं. We have to prevent this RAS pathway to get activated. We have to prevent this RAS pathway to get activated. And how can we prevent this RAS pathway to get activated? By giving some drugs which are inhibitor of RAS pathway. So which medicines are RAS pathway inhibitors? So how we can prevent cardiac remodeling? So prevention of cardiac remodeling. How we can do prevention of cardiac remodeling? This is done by inhibiting the RAS pathway. So any medicine that is inhibitor of RAS pathway can prevent the cardiac remodeling. And which are these drugs which can prevent the cardiac remodeling? One is beta blocker. So whenever we give beta blockers will inhibit the JG cells. So one of the location of beta receptor is JG cells of the kidney. So beta 1 receptor has 4 locations we discussed yesterday. One of the location of beta receptor is JG cells of kidney. So that JG cell of kidney is stopped. So the RAS pathway is stopped. When the RAS pathway is stopped, the remodeling will not take place from day 1. So these beta blockers are given for CHF. Right? And please remember, the best beta blocker for CHF patient is carvedilol. Do you remember carvedilol? Carvedilol is the same beta blocker which has 4 properties. Carvedilol is the same beta blocker which has 4 properties. So car has 4 wheels, it has 4 properties. What are the 4 properties? A, B, C. A stands for alpha blocker, B stands for beta blocker, C stands for calcium blocker, and A also stands for antioxidant. So these are the 4 properties we have. Right? So carvedilol is the best beta blocker to be started in patients of CHF. So question will come to you, what is the role of beta blockers? What is the role of beta blockers in patients of heart failure? So answer is, beta blockers are given for 2 reasons for heart failure. Number 1 reason is, they are used as a first line drug for compensated heart failure. Number 1 reason is prevention of cardiac remodeling. So beta blockers are given for prevention of cardiac remodeling and also given to prevent the tachycardia. So beta blockers are given to prevent tachycardia, that's quite obvious. So beta blockers inhibit beta 1 receptor, reduce the heart rate, and also given to prevent the cardiac remodeling. 2 reasons for using beta blockers in CHF. Okay? So this topic is important. They asked this question in June 2022 exam. So June 2022 exam, this question was asked. So June 2022 exam, the question on cardiac remodeling was asked. But although they didn't ask the beta blocker, तो beta blocker पे question नहीं था, but they asked the medicines which can block the RAS pathway and therefore you can prevent cardiac remodeling. ठीक है? Now next indication is myocardial infarction. So again in myocardial infarction, it's a cardiovascular indication. We use generation 2 and generation 3 medicines. So when we block beta receptor, it will reduce the heart rate. This will reduce the oxygen demand. So we can use the medicines for MI also. 6th indication. Now we are moving on to the non-cardiovascular indications. So these are the non-cardiovascular indications. So first 5 indications are cardiovascular indication. The next 5 indications are non-cardiovascular indications. So we have a lipid soluble beta blocker which can cross blood-brain barrier. We have a lipid soluble beta blocker which can cross blood-brain barrier. The drug name is propranolol. So propranolol is a generation 1 beta blocker. It's a lipid soluble beta blocker. It can cross blood-brain barrier. And the 4th location of beta 1 receptor is CNS. Do you remember there are 4 locations of beta 1? Can any one of you send me the locations? Any volunteer would like to send me? What are the 4 locations of beta 1 receptor? What are the 4 locations of beta 1 receptor in human body? Very good. Answer is CNS, ciliary body, cardiac cells and JG cells. तो कार्डियक तो हमने बहुत बार डिस्कस किया है कि कार्डियक को इनहिबिट करके मेडिसिन्स आर यूज्ड एज एंटी एरिथमिक्स, मेडिसिन्स आर गिवन फॉर एंजाइना, मेडिसिन्स आर गिवन फॉर हाइपरटेंशन, मेडिसिन्स आर गिवन फॉर एमआई. तो कार्डियक तो हो गया. जेजी सेल हमने डिस्कस किया कि बाय ब्लॉकिंग द जेजी सेल्स, by blocking the JG cells, medicines are given for CHF because medicines prevent remodeling. Medicines prevent remodeling, so given for CHF. Third is now CNS. We are moving on to CNS now. The third location of beta 1 receptor is CNS. Now in CNS, medicine block beta 1 receptor, and by blocking beta 1 receptor, this medicine can block the anxiety center. The name of the anxiety center is not important. So medicine can block the anxiety center, and because this medicine can block the anxiety center, this beta blocker like propranolol can reduce the anxiety. So please remember, beta blocker propranolol is drug of choice for performance anxiety. Drug of choice for performance anxiety, which is also known as stage anxiety. Drug of choice for stage anxiety, performance anxiety, also known as examination fever. So examination fever, stage anxiety, performance anxiety, best medicine is propranolol. So whenever you have to perform somewhere, this you people must be knowing now. Whenever you have to perform somewhere, it can be your exam, it can be the stage performance, it can be your viva, it can be your seminar, or when you are going for a date. So when you are going for a date with someone first time in your life, so that anxiety is the performance anxiety. So whenever you have to perform somewhere, this can be your exam, can be your stage, can be the seminar, can be any personal event of your life. So you can have tachycardias, you can have tremors, sweating, all these things are there. So if you take beta blockers will take care of all these symptoms. So before going for the performance, if you take beta blocker propranolol, this is a wonderful medicine which will control all these symptoms, and you can perform better. You can perform better during your performance. So best medicine for performance anxiety, stage anxiety, examination fever, propranolol is the best medicine to start. Right? Now, हाँ डॉक्टर 4th December को you can take this medicine. डॉक्टर 4th December को मत लेना. You start, if you want to start the medicine, start 1 week before, because your body will adapt with the medicine. You can take it, there is no harm. If you cannot handle the anxiety of exam, then you take it, because थोड़ा सा sedation रहेगा इसमें, like sleep is more. But otherwise तो there is no harm. Like if you cannot handle the pressure of exam and you think that anxiety can interfere with your performance, so it's always better to take the medicine, right? So migraine prophylaxis, esophageal varices prophylaxis. So please remember, migraine and esophageal varices is due to the vasodilation. Migraine में भी vasodilation problem है, और esophageal varices में भी vasodilation is the problem. So migraine and esophageal varices, the basic problem is vasodilation. So whenever there is a vasodilation in your brain, whenever there is a vasodilation in your cranial region, cerebrum, so these blood vessels which are dilated, this can stretch the meninges. This can stretch out the meninges. So blood vessels which are dilated will stretch out the meninges, and that will cause pain. So by reducing the blood supply, by causing the vasoconstriction, so these medicines can cause vasoconstriction. Because of the tendency to cause vasoconstriction, these medicines can control migraine, can also control esophageal varices. Guys, have you people covered surgery subject? Do you know what is esophageal varices? Do you know esophageal varices? Okay, covered. So you people know, you have idea. Okay, good. So yes, due to portal hypertension, you have this vasodilation, you have this blood vessels dilatation at the lower end of esophagus. So propranolol, noradolol can be given to constrict those vessels. So they are the best medicine, they are the drug of choice. So these medicines are drug of choice for migraine prophylaxis, where the basic problem is vasodilation, and these medicines are also drug of choice for esophageal varices prophylaxis. Now by blocking the beta 1 receptor, in brain, by blocking the beta 1 receptor in brain, these medicines can also control the tremors. So propranolol is drug of choice for essential tremors. So essential tremors are those tremors where you cannot find the brain pathology. Like, let me give you one example, right? You must have seen in old patients. You must have seen there is a trembling of hands. So old patients have tremors, but it does not mean that all old human beings are suffer from Parkinson. So these tremors, which are not Parkinsonism, but that occurs with age and that occurs because of some unknown reason, that is known as essential tremors. So any tremor that occurs with the age, you must have seen in some young patients also, young adults, 50-year-old, 40-year-old. So these human beings can also have tremors. So these are known as essential tremors. So propranolol is a drug that is given to take care of those essential tremors. So propranolol is the best medicine to take care of essential tremors. And please remember, there is one more indication of propranolol which is missing over here. So please write it down. I think you have covered that property of propranolol in psychiatry class. There is one condition that is known as akathisia. The condition is known as akathisia. So the problem is known as akathisia. So if you remember the psychiatry class, akathisia is a technical word which we use for inner restlessness. Akathisia is a technical word which we use for inner restlessness. So akathisia is a condition, we also call it inner restlessness. In Hindi we call it बेचैनी. तो अगर पेशेंट आपके पास आके बोलता है कि सर बहुत बेचैनी है, और पेशेंट विल से सर आई एम वेरी रेस्टलेस, I cannot sit at one place, I cannot concentrate on my work because of restlessness, right? This is akathisia. So please remember, drug of choice for this akathisia is also propranolol. So propranolol is the best medicine for akathisia, best medicine for restlessness, best medicine for becheni. Although you can also give alcohol, but alcohol we cannot prescribe. Alcohol is also very good for becheni, but as a doctor you will write only propranolol in prescriptions. ठीक है? Now akathisia is a problem which is very commonly seen with the use of antipsychotic drugs. In psychiatry you must have covered this side effect of antipsychotic medicines. Any person who take antipsychotic medicine, will develop restlessness after 3 to 4 months of therapy. So we can start propranolol to this patient to take care of this restlessness, akathisia. Now the 10th indication is glaucoma. So one more non-cardiovascular indication is glaucoma. So please remember, in patients of glaucoma, these medicines can inhibit the ciliary body. So the fourth location of beta receptor. The fourth location of beta receptor is now ciliary body. So ciliary body is inhibited by beta blockers and therefore reduce the aqueous humor synthesis. And by reducing the aqueous humor synthesis, medicines are given for glaucoma. There are two medicines which are useful for glaucoma here. The first medicine is timolol. The second is betoxolol. So timolol is generation 1, which is better than betoxolol, which is generation 2. So timolol is a better drug than betoxolol, and we have discussed already. Timolol is a generation 1 medicine. Now who will tell me what are the two important side effects of generation 1 medicines? Who will tell me two important side effects of generation 1 medicines? Generation 1 medicines block beta 2 receptor and can result in two big issues. What are the two big issues with generation 1 medicines? Contraction of what? So generation 1 medicines can cause bronchoconstriction and can cause vasoconstriction. Very good. So one doctor has given the answer, vasoconstriction and bronchoconstriction. Now many of you have given the answer. So bronchoconstriction, vasoconstriction are two important side effects. So this question is asked this time in your June 2022 exam. So June 2022 exam, they asked this question on timolol. So timolol is a generation 1 beta blocker which is given for glaucoma, and this medicine can cause bronchospasm. This medicine can cause bronchospasm, can cause vasospasm, and because of this vasospasm, bronchospasm, we should not use this medicine in patients of bronchial asthma. We should not use this medicine in patients of bronchial asthma and hypertensive crisis. So medicine can cause hypertensive crisis and bronchial asthma. So we should avoid using timolol as an anti-glaucoma drug for those patients who have bronchospasm. Okay. So timolol question was asked this year in exam. Be careful. Can be repeated this time also. Okay, now let's talk about some properties of beta blocker, duration of action of beta blockers. Some long-acting beta blockers like nadolol, sotalol. This topic is not important for your exam, but the important one is the short-acting medicine. The long-acting medicines names are not important, but for the just sake of completion, remember the names nadolol, sotalol. The shortest acting medicine name is very important for your exam. The drug name is esmolol. So esmolol is a drug which is the shortest acting beta blocker, and we discussed already this medicine contains the words or letters E and S. So E and S stands for ester bond. So medicine contains ester bond. This medicine contains ester bond, and because this medicine contains ester bond, this medicine is metabolized by RBC esterase enzyme. Medicine is metabolized by RBC esterase enzyme, and medicine action lasts only for 8 to 10 minutes. So this medicine action lasts only for 8 to 10 minutes. The drug name is esmolol. So esmolol is a medicine where the action lasts only for 8 to 10 minutes. It's the shortest acting beta blocker available in the market. That's all about this topic, beta blockers. Now let's finish anti-glaucoma drug, then we'll revise all these medicines once again, and then we'll take a break. Okay? Or the second option, we can finish anti-glaucoma drug and then we can take a break, and then immediately after break we can revise these topics. So totally up to you, as per your choice, I'll go accordingly. Okay, let's finish anti-glaucoma drug. Okay, but one thing is more. Have you people covered anti-glaucoma drug topic in ophtha? I think ma'am must have covered. Ma'am mostly covered this topic of anti-glaucoma drug. Have you people covered anti-glaucoma drug? हाँ तो वही है, तो there is no point of wasting time over here. So read notes from the one source only. So this topic is already covered in the ophtha. So I suggest you to read the ophtha notes, because if you have already covered one topic, you have already made the notes, you have invested your time, so no point of wasting the time in two places, right? So please revise your ophtha anti-glaucoma drug notes. So this topic is over from my side. This topic is over from my side. ANS topic is over. So if you want, I can take the break, or if you want, I can revise all these drugs. What is a better suggestion? Okay, you want to revise anti-glaucoma drugs. Okay, fine. Let's revise this anti-glaucoma drugs. Let's revise anti-glaucoma drugs. I will do the revision for you people. Anti-glaucoma drugs revision. So if we talk about anti-glaucoma drugs, if we talk about anti-glaucoma drugs, if we talk about anti-glaucoma drugs, anti-glaucoma drugs we can divide in two groups. Anti-glaucoma drugs we can divide in two groups. Number one, medicines which can increase aqueous humor drainage. Medicines which can increase aqueous humor drainage. And number two, medicines which can reduce aqueous humor synthesis. medicines which can increase aqueous humor drainage, and medicines which can reduce aqueous humor synthesis. There are two ways of treating glaucoma. One is we can increase the drainage of aqueous humor, or we can reduce the synthesis of aqueous humor. Now there are two methods by which we can increase the aqueous humor drainage. First type of drainage is known as trabecular drainage. So there is a group of medicine which can increase the trabecular drainage, and the second group of medicines are those which can increase the uveoscleral drainage. So medicines which can increase the trabecular drainage. Trabecular drainage means the angle in iridocorneal angle. So medicines will cause widening of iridocorneal angle. So medicines will increase the trabecular drainage. And the second is medicines which can increase the uveoscleral drainage. Now the medicines which can increase the trabecular drainage that we discussed yesterday, the drug name is pilocarpine. The drug name is pilocarpine, and we discussed already pilocarpine starts with word PI, and this will make the pupil pinpoint. This will make the pupil pinpoint. And when this medicine will make the pupil pinpoint, this will cause widening of peripheral angle. This will cause widening of peripheral angle. So the iridocorneal angle become wide, so peripheral angle become wide, and this will increase the trabecular drainage. The drug name is pilocarpine, and we discussed the side effect. There are 4 side effects of this medicine which you can remember by the mnemonic 4P. We discussed yesterday 4 side effects, if you remember, right? Like pain in the eyes, decreased vision, punctum blockage, peripheral retinal detachment. Now the second group of medicine is medicines which can increase uveoscleral drainage. So medicines which can increase uveoscleral drainage, these medicines are known as prostaglandin F2 alpha analogs. So medicines are known as prostaglandin F2 alpha analogs. The medicines को बोलते हैं prostaglandin F2 alpha analog. The drug which belong to this class is latanoprost. The drug is latanoprost, which is prostaglandin F2 alpha analog, right? And please remember, overall this medicine is considered as drug of choice for glaucoma. So this is the best medicine for the treatment of glaucoma, latanoprost. Overall best medicine is latanoprost, right? Now when this latanoprost is given to a patient, what are the side effects of latanoprost? So please remember, whenever we give latanoprost to a patient, this medicine can cause some side effect. The mnemonic is clip. So medicine side effect mnemonic is clip. So latanoprost is a medicine which can cause side effect. The mnemonic is clip, right? So what is the full form of clip? So what is the full form of clip? If you go back to this, prostaglandin analogs. The drug is latanoprost, which is overall drug of choice for glaucoma. Mechanism of action we have discussed. This medicine can increase uveoscleral drainage. Medicine can increase uveoscleral drainage. Drug of choice for glaucoma. Medicine side effects are CLIP, C-L-I-P, where C stands for cystoid macular edema. So this medicine is a prostaglandins, and whenever you give prostaglandins are inflammatory mediators. Prostaglandins are inflammatory mediators, can cause edema in your macula. So prostaglandins, which are inflammatory mediators, will do the functions like a inflammation, will result in inflammatory like changes, and one of the inflammatory changes is edema. So edema can occur. So cystoid macular edema. This medicine can cause lengthening of eyelashes. So medicine can cause increased length of eyelashes. So some students remember like this way. Latanoprost starts with word LA. So they remember like this way. LA का मतलब है lashes. So medicines can increase the length of eyelashes. Medicines can cause increased length of eyelashes. So increased length of eyelashes is a side effect. These medicines can cause inflammation. We discussed already. ये prostaglandins हैं. Prostaglandins are inflammatory mediator. So can result in inflammation in eyes and can result in side effect like uveitis and keratitis. So patient can have symptoms resembling uveitis and keratitis. Uvea inflammation, cornea inflammation. And P stands for pigmentation. So these medicines can also cause pigmentation of iris. Medicine can cause brown pigmentation of iris, and when there is a pigmentation of iris, This pigmentation is not symmetrical, this is asymmetrical. So normally the iris is black color. Now in between black color there are brown patches. There are brown patches, so we call it heterochromia. We call it heterochromia. Heterochromia means different colors. Different colors, multiple colors. So heterochromia iridis. So side effect of the medicine is known as clip, cystoid macular edema, increase length of eyelashes. I stands for inflammation. देखो easy है ना, ये C से है cystoid macular edema, L is for eyelashes, lashes side effect, increase length, I is for inflammation, P is for pigmentation. So L is for lengthening of eyelashes, I is for inflammation, P is for pigmentation. The side effect is heterochromia iridis. Now we have some drugs which can reduce aqueous humor synthesis. We have some medicines which can reduce aqueous humor synthesis. So these medicines are total 4. Number 1, some we have discussed already, like beta blocker we have discussed today. So medicines are timolol, second is betoxolol. So timolol and betoxolol inhibit the beta 1 receptor, inhibit beta receptor in ciliary body of eye. So inhibit the ciliary body, reduce the aqueous humor synthesis. Similarly, there is one more receptor which is on ciliary body of eye, that is alpha 2 receptor. So the medicines which are alpha 2 receptor stimulator, like we have brimonidine, if you remember, and one more is epiraclonidine. So these medicines will act in CNS also. So avoid it in children and neonates, otherwise medicines will cause respiratory suppression. Important side effect is retraction of eyelid. Retraction of eyelid is important side effect. Number 3 group of medicine we will discuss in topic of kidney. We call them carbonic anhydrase inhibitors. So medicines are known as carbonic anhydrase inhibitors. Medicines are known as carbonic anhydrase inhibitors that we will cover in topic of kidney. And in carbonic anhydrase inhibitor, there is a drug. There is a drug. The drug name is acetazolamide. There is a drug acetazolamide. This acetazolamide is considered as drug of choice for acute attack of glaucoma. This is drug of choice for acute attack of angle closure glaucoma. It is drug of choice for acute attack of angle closure glaucoma. The drug is acetazolamide. And the last medicine is given, the drug name is mannitol. Mannitol is a drug which is always given by IV route. Mannitol is a drug which is always given by IV route, and this is given for the treatment of acute attack of closed angle glaucoma which is refractory to acetazolamide therapy. So acute closed angle glaucoma or angle closure glaucoma. So acute attack of angle closure glaucoma which is refractory to acetazolamide therapy. Now please remember, if we talk about glaucoma, we discussed that there are 2 types of glaucoma. One is known as open angle glaucoma, second is known as angle closure glaucoma. So whenever patient of open angle glaucoma will come to us, please remember, open angle glaucoma में acute attack नहीं होता. In open angle glaucoma, there is no acute attack. Patient will always come to us in emergency, in OPD. So in open angle glaucoma, you will always start your treatment with prostaglandin F2 alpha analogs. But if it is not controlled, NC का मतलब है not controlled, you always start your therapy with latanoprost, prostaglandin F2 alpha analog. But after starting latanoprost, if the patient pressure will not come down, it is not controlled, then you will add beta blockers. So second group of medicine is timolol or betoxolol. Right? So prostaglandins are the best medicines for open glaucoma, and if it is not controlled, you will add beta blockers. Now acute glaucoma, angle closure glaucoma. Now angle closure glaucoma, patient will come to us in acute attack. So when the patient will come to us in acute attack, for the treatment of acute attack, I will start acetazolamide I will start acetazolamide plus I will start pilocarpine eye drops. So I will start pilocarpine eye drops and I will give acetazolamide, which is given either by IV route or by oral route. So for acute attack of glaucoma, I will start two medicines together. I will start two medicines together. One is acetazolamide, second is pilocarpine eye drops. So acetazolamide is the best medicine out of all. So it's a best medicine that can reduce the pressure in a best manner. It's a best medicine to start, but it is given along with pilocarpine. And after this acute attack is relieved. आफ्टर दिस एक्यूट अटैक इज रिलीव्ड, कि आपने पेशेंट का एक्यूट अटैक को रिलीव कर दिया. सो एक्यूट अटैक इज रिलीव्ड, देन यू टेक दिस पेशेंट फॉर सर्जरी. You will take the patient for surgery of the angle. So you will perform the peripheral iridotomy. So peripheral iridotomy is performed. So you will perform the surgery. Now you will open the angle permanently. अपने angle का problem solve कर दिया. You have performed the surgery and you have widened the angle permanently. About drainage तो होता ही रहेगा. Now this angle is not an issue, right? Now you have performed the surgery. Now you will discharge the patient from the hospital. So for maintenance treatment, lifelong you will put patient on latanoprost. So maintenance treatment में you will give one eye drop to a patient कि whenever he feels that there is a pain in the eye, he can take latanoprost eye drops. So latanoprost are the drug of choice for both type of glaucoma. So ultimately for maintenance treatment we have to give prostaglandins, but only during acute attack of glaucoma we give acetazolamide first, relieve the attack along with pilocarpine, then perform the surgery. The surgery is known as peripheral iridotomy, and once the surgery is done, the angle is not an issue now, and if there is still high pressure, you can prescribe latanoprost. Now you will treat this patient like a open angle glaucoma. Once the angle problem is resolved, you will treat the patient like a open angle glaucoma. This is how we manage a patient of glaucoma. This glaucoma topic is over. Let's take break for some time. It's 11 o'clock now. So 11:02 है, we'll come back at 11:22. So 20 minutes break. So have your breakfast. Enjoy your breakfast with tea or coffee or maybe juice, but avoid hard drink or soft drinks. Welcome back to all of you. I hope you had a great breakfast today. So please confirm me about audio and video. Audio, video, all okay or not? Anyone who is there? Anyone who has returned after having the breakfast? Okay, all clear. Thanks, doctor. Thanks for the confirmation. Right. So we have just covered one topic of autonomic nervous system, and let's discuss some MCQs. What is the answer of question number 1? Which statement is correct out of these four? Which statement is correct out of these four? So, brimonidine. What is the mechanism of action of brimonidine in anti-glaucoma drugs? Brimonidine will increase the drainage or reduce the aqueous humor synthesis. The answer is brimonidine will decrease the aqueous humor synthesis. Brimonidine will decrease the aqueous humor synthesis. This is the mechanism of action. So discussed already in topic of glaucoma. Look at here. We have only two type of medicines. Either the medicine will increase the drainage or medicine will reduce the synthesis. So the medicines which will increase the drainage we can divide in two classes. The medicine which will increase trabecular drainage is pilocarpine, and the medicine that will increase the uveoscleral drainage is prostaglandin. The rest of the medicines, the four group of medicines, act by the same mechanism. They reduce aqueous humor synthesis. Nobody will ask you how exactly they reduce aqueous humor synthesis. So just remember grossly, broadly, that medicines reduce aqueous humor synthesis. Right? So latanoprost is a medicine. Latanoprost is a medicine which will increase the uveoscleral drainage. Pilocarpine is a drug that will increase the trabecular drainage, and betoxolol is a drug that will reduce the aqueous humor synthesis. So these three statements are false. Only the first statement is true, right? Next is, let's move on to question number 6. Now there are 6 side effects of beta 2 agonist which we discussed already. Which of the following is an adverse effect of beta 2? Now you have to answer this question, as well as you people have to tell me the 6 side effects of beta 2 agonist. I will give you one hint. 3 side effects starts with T, 3 side effects starts from H. 3 side effects starts from T, 3 side effects starts from H. Yes, the answer is D, Delhi. Answer is hypokalemia. So one of the side effect of the medicine is hypokalemia, no doubt. So H is for hypokalemia. What are the other side effects of this medicine? Anybody? अरे अनुकूल आया है आज, अनुकूल. Very good. So Dr. Susan, Dr. Kishan, Shikha, all of you have given the correct answer. Many more have given the correct answer, but they want to keep their name as anonymous. Very good. So most of you have given the correct answer. So medicines can cause tremors. Medicine will cause tremors, tachycardia, tachyphylaxis. Tremors, tachycardia, tachyphylaxis. And 3 side effects from H are hypokalemia, hyperkalemia, and hypotension. Anukul is present. Anukul, send a voice message of these 6 side effects. Of these 6 side effects, send a voice message. Okay, till the time Anukul will send this message, we'll discuss the next question. What is the renal dose of dopamine? What is the renal dose of dopamine? Renal dose is 2 to 5, 5 to 10, or 10 to 20, or 1 to 2. So which one is the dose in which it is exclusively acting on kidney? So please remember, less than 2 dose is known as renal dose. 2 to 10 dose where beta 1 receptor is involved, and when beta 1 receptor is involved, this is known as cardiac dose, and more than 10 is known as vascular dose. More than 10 is known as a vascular dose. So less than 2 renal dose, 2 to 10 cardiac dose, more than 10 is vascular dose. So these are the three type of dosing of dopamine. So in this case, the best answer is 1 to 2. Best answer is 1 to 2 microgram per kg per minute, right? And you know the receptors also. Anyone would like to answer? In less than 2, this medicine will act on which receptor? In 2 to 10, medicine acts on which receptor? So in less than 2, 2 to 10 and more than 10. Less than 2, medicine will act only on D1 receptor. 2 to 10, it will act on D1 and beta 1 receptor both. And in more than 10, it will act on D1, beta 1 and alpha 1, all three receptor. It will act on all three receptors. Question number 8. Question number 8 is based on esmolol. So any idea about esmolol? Esmolol belongs to which class? Esmolol belongs to which class? Very good. So esmolol is a cardioselective beta blocker. It's a cardioselective beta blocker. Cardioselective beta blockers are generation 2 beta blockers. They are the generation 2 beta blockers. The mnemonic is BEAM. We have betoxolol, we have esmolol, atenolol and metoprolol. So we have betoxolol, esmolol, atenolol, metoprolol. We have some generation 1 drugs also. So generation 1 medicines are non-selective beta blocker. Generation 1 medicines are non-selective beta blockers. So these medicines block beta 1 and beta 2 receptor both. Medicines block beta 1 and beta 2 receptor block. And by blocking the beta 2 receptor, these medicines can lead to two problems. The one we discussed already, bronchospasm. The second is it will cause vasoconstriction. So bronchospasm, vasoconstriction, and the mnemonic is protein shake. So many of you have sent the generation 1 drugs name also. The mnemonic is protein shake. One more example is proper non-selective drugs. So proper non-selective is easy mnemonic. So proper means propranolol, non is for nadolol, and selective is for sotalol, generation 1. Now esmolol is a drug, it's a generation 2 medicine. This will not increase the airway resistance. So this is the property of generation 1. It's not a property of generation 2, it's a property of generation 1. Right? So this statement is false. This will not cause increase in bronchospasm. So bronchospasm is a side effect of generation 1, not of generation 2. It causes tachycardia. No. Please remember, no beta blocker causes tachycardia, because all beta blockers are blocker of beta 1 receptor. All beta blockers, whether they are generation 1, 2 and 3, they are blocker of beta 1 receptor, either in specific or non-specific way. So ultimately, all beta blockers will cause bradycardia. There is no beta blocker which can cause tachycardia as a side effect. So this is the wrong option. And medicine half-life, medicine duration of action is 4 hours. This is also false. We discussed already. Esmolol is the shortest acting beta blocker. Esmolol is the shortest acting beta blocker, and this medicine is rapidly metabolized by esterase enzyme. This is rapidly metabolized by esterase enzyme, and duration of action is only 8 to 10 minutes. It's not 4 hours, it's 8 to 10 minutes. So esmolol action does not last for 4 hours. Right? Now who will tell me for which condition esmolol is drug of choice? Esmolol किस condition का drug of choice है? Anyone would like to answer? Esmolol is drug of choice for which type of hypertensive crisis? Answer is esmolol is a drug of choice for hypertensive crisis. Very good. That is associated with aortic dissection. So hypertensive crisis associated with aortic dissection, esmolol is the drug of choice. So esmolol is a drug of choice for hypertension crisis with aortic dissection. Very good. Good. Next is alpha 1 blocker. Alpha 1A, sorry, not alpha 1, alpha 1A blocker, which will provide symptomatic relief in patients of BPH. So which medicine out of these four? Tamsulosin, prazosin, doxazosin and tolazolene. Out of these four, which medicine is the best medicine to start for BPH? You have to tell me the name of that medicine, right? Obviously, the drug of choice is tamsulosin. It's a drug of choice for BPH. Now, you have to tell me the two side effects of this medicine also. You have to tell me two side effects of this medicine. What are the two side effects of tamsulosin? Dr. Pradeep, try this question. What are the two side effects of tamsulosin? Pradeep, answer this question. What are the two important side effects of tamsulosin? अगर ओल्ड पेशेंट टेम्सोलोसिन लेगा तो दैट पर्सन हैज विच टू प्रॉब्लम्स? वेरी गुड. So that person can have two problems. Number one, retrograde ejaculation. So that person can have retrograde ejaculation and can result in floppy iris syndrome. Floppy iris syndrome and can result in retrograde ejaculation. Right? So some students remember like this way: fire. So floppy iris syndrome and retrograde ejaculation. The drug name is tamsulosin. The drug name is tamsulosin, and I don't know in which language the word is tamsin या तमसो. तमसो का मतलब होता है फायर्स के साथ. I don't know in which language this tamso word is related to this fire. So you can make the mnemonic as per the regional language, right? So tamso is ag, this is fire. So fire is floppy iris and retrograde ejaculation. The drug is tamsulosin, right? Okay. Question number 10. Which of the following drug has no cycloplegic action? Okay, you do one thing. Without answering this question, give me one answer. You have to arrange all these medicines. You have to arrange these four medicines in order of their cycloplegia. You have to start with minimum cycloplegic action towards the maximum. So arrange these medicines from their minimum cycloplegic power to maximum cycloplegic power. So arrange these four medicines in order of minimum cycloplegic power to maximum cycloplegic power. Anyone? इनको arrange करो. Arrange four medicines in order of their minimum power to maximum power. Four drugs are written in front of you. Instead of writing the names, you can just write ABCD if you want. Very good. So you are smart people. You have started answering like this way only. Yes, the order is reversed. That is DCBA. Very good. So D has minimum. It has no cycloplegic action. Followed by, we have some problem in software. So D followed by C, then B, then A. So A has maximum, followed by cyclopentolate, then tropicamide, then phenylephrine. So question 11 is a repeated question. The answer is A again. We discussed already. Question 15 is also repeated question. We have discussed already, phenylephrine. Question number 18. Which of the following effect is associated with beta 3 receptor stimulation? Now before answering this question, you have to send me a message where you will write all mnemonics of alpha 1, alpha 2, beta 1, beta 2 and beta 3. So what are the locations of alpha 1, alpha 2, beta 1, beta 2, beta 3? Answer is easy. यहाँ पे answer lipolysis है. Beta 3 is present on adipocyte that will cause lipolysis. But what are the locations of alpha 1, alpha 2, beta 1, beta 2, beta 3? Alpha 1 locations are, mnemonic is probes. Very good. Arey वाह. One student has done a shortcut. Right? So answered in minimum words. Yes, so alpha 1 is probes, prostate, blood vessel, eyes, and sphincter. Alpha 2, 2C, remember CNS and ciliary body. So CNS is inhibited by clonidine and alpha methyl dopa. Ciliary body is inhibited by brimonidine and apraclonidine. Beta 1, the mnemonic is 4C, right? And beta 2, all muscles. Beta 2, it is present on all muscles. And smooth muscles are relaxed, other muscles are contracted. And beta 3 is present over adipocytes on fat cells. Good, Dr. Rushabh. Most of you have given the correct answer. Okay, now the last question for you people, question number 19. Which medicine will act on alpha 1, alpha 2, beta 1, beta 2? So which is a drug out of these four which will act on all these four receptor, alpha 1, alpha 2, beta 1, beta 2 receptor? Find out the drug which will act on all these four receptor. Answer is very good. Answer is epinephrine. Correct answer. So epinephrine is the answer. So epinephrine is a drug that is stimulator of all alpha, all beta. That includes beta 2 as well as beta 3. Right? So alpha 1, alpha 2, beta 1, beta 2, beta 3. But norepinephrine will not act on beta 2. Norepinephrine will not act on beta 2 as a main receptor is beta 2. Beta 2 is a main receptor which was discovered in experiment vasomotor reversal of Dale. So vasomotor reversal of Dale discovered this beta 2 receptor. That's why this receptor is very important for us in pharmacology. Okay, that's all about these MCQs. Okay, now I'll write the names of some drugs and you have to answer me for which conditions these medicines are drug of choice. Right? I will write the names of some medicines and finally you have to answer in one message that these medicines are drug of choice for which conditions, right? There is some problem in software. Guys, give me 1 minute. Let me correct this. Yeah, so sorry for this delay. So the drug is phenoxybenzamine. The second drug for you is prazosin. Third drug for you is modafinil. The fourth drug for you is labetalol. The fifth drug for you is phentolamine. The sixth medicine for you is physostigmine. The seventh medicine for you is latanoprost. The eighth medicine for you is methylphenidate. Ninth medicine for you is pyridostigmine. Tenth medicine for you is uh, tenth medicine is glycopyrrolate. So answer me this question. Where do we use these medicines as a main drugs? Where do we use these medicines as a main drug? 10 questions for you. Phenoxybenzamine, prazosin, modafinil. Very good. So student has given the answer, Dr. Donald. So phenoxybenzamine we have discussed. This medicine contains a word ban. So this medicine will ban the alpha receptor. This medicine will ban the alpha receptor. And how this medicine will ban the alpha receptor? By blocking alpha receptor irreversibly. So this is irreversible blocker of alpha receptor, and because it is irreversible blocker of alpha receptor, this will ban the alpha receptor and useful for pheochromocytoma as a drug of choice. Now prazosin is best medicine for scorpion sting. It's a best medicine for scorpion sting. Modafinil is best medicine for narcolepsy. We discussed a mnemonic that before the final exam you have to take this modafinil to keep yourself awake. So keep yourself awake before the final exam, you have to take modafinil. Labetalol, drug of choice for PIH. Phentolamine, we discussed a mnemonic. Labetalol, we discussed this mnemonic that it is alpha and beta receptor block. It is blocker of alpha and beta receptor both, alpha beta, labetalol. Phentolamine, we discussed a mnemonic that Fenta should be consumed with cheese always. Fenta is consumed with cheese, so it's a drug of choice for cheese reaction. Physostigmine is drug of choice for atropine toxicity. Latanoprost is drug of choice for glaucoma. Methylphenidate is drug of choice for ADHD. And pyridostigmine is drug of choice for myasthenia gravis. And where do we use glycopyrrolate? None of you have answered, or some of you have answered. Where do we use glycopyrrolate? Yes, so many of you have answered. It's a drug which we use used as a pre-anesthetic medication. So it is used as a pre-anesthetic medication. The drug is glycopyrrolate. ठीक है, तो ये हो गया, फिनिश हो गया टॉपिक. Let's start with next topic, respiratory system. You people are asking modafinil ka side effect. Modafinil side effect is nothing, just a abusive property. The brain become addict of modafinil. And second is hypertension and tachycardia. So modafinil can cause hypertension, tachycardia, and insomnia. These kind of things are there, right? जो भी sympathetic effects हैं, remember reverse opposite of dumbbell is the action of sympathetic system, and modafinil stimulate the noradrenaline effect. So this will lead to all actions which are of sympathetic system. But if you want to take it for few days, like 15 days, 20 days, 1 month, and you're not a case of heart disease, you're not a case of hypertension, you don't have any other problem going on, then this is a good medicine. Chances are very low that medicine will cause any side effect. So it's a safe medicine, good medicine. Next topic is respiratory system. So in respiratory system, the only thing they ask in your exam is drugs for bronchial asthma. So the medicines which we use for bronchial asthma, we'll discuss those medicines, but first of all, we will discuss the pathophysiology of bronchial asthma. How bronchial asthma take place? So whenever we inhale any allergen, this allergen which has entered in bronchiole. So allergen you have inhaled. So there is a climate. In climate we have allergens. So you will inhale these allergens. Now these allergens are immediately engulfed by one cell known as antigen presenting cells. So allergens you will inhale, and when you inhale the allergen, now these allergens are engulfed. These allergens are engulfed by or taken up by antigen presenting cell. APC का full form है antigen presenting cell, right? Now this antigen presenting cell will take this allergen to nearest lymph node. Antigen is taken to the nearest lymph node, and in lymph node we have the presence of, patient has the presence of Th2 cell. Now this is the only change in bronchial asthma. Normally the human beings have mainly Th1 cells. But the patient has Th2 cells. So ये change है bronchial asthma में और normal human being में. Whenever a normal human being like all of us, we consume allergen, we inhale allergen. So this is taken to the lymph node where Th1 cell get activated and neutralize the allergen. But in bronchial asthma patient, it is not the Th1 cell, it is mainly the Th2 cell which is present over there, which get activated. And when this Th2 cell is activated, this Th2 cell will change its shape and become the plasma cell. And when this Th2 cell will change its shape, become the plasma cell, this will secrete out the IgE. And this IgE will interact with DNA of mast cell. So IgE will act on mast cell. So it will act on DNA of mast cells, and when it will act on DNA of mast cells, this will result in increased expression. Of some enzyme, that is phospholipase A2. So there is an increased expression of phospholipase A2. So PLA2 का full form है phospholipase A2. So phospholipase A2 level will increase, and this phospholipase A2 will further increase the level of LOX. Now what is this LOX? The LOX is lipoxygenase enzyme. So LOX is lipoxygenase, PLA2 is phospholipase A2. So phospholipase A2 will increase the level of lipoxygenase enzyme. Now lipoxygenase enzyme which is formed over here, this lipoxygenase enzyme will form leukotrienes. ये बनाएगा leukotrienes. Now leukotrienes which are formed here in this mast cells, these leukotrienes are released from the mast cells. These leukotrienes will interact with their respective receptors. We call them leukotriene receptors. Can result in inflammation of bronchioles, and whenever there is an inflammation of bronchioles, this results in spasm of smooth muscles of bronchioles and cause bronchoconstriction. This will cause bronchospasm. So we have allergen. Allergen is inhaled by any human being because they are present in surroundings, present in environment. Now these allergens are taken up by antigen presenting cells and take it to the nearest lymph node. Our lymph node mein immunity is activated. So body immune mechanism is activated with the help of Th2 cells. So Th2 cell is activated, that will convert it to plasma cell. Now plasma cell will form IgE. and this IgE interact with DNA of mast cell, and when this IgE will interact with DNA of mast cell, this will result in increased expression of phospholipase A2. Phospholipase A2 will further convert it to LOX, that is lipoxygenase enzyme. Now the lipoxygenase enzyme will form leukotrienes, which are later on released by the mast cell. Now these leukotrienes will act on their receptors, will result in inflammation of bronchioles, and because of this inflammation of bronchioles, there is a narrowing of smooth muscles or narrowing of the bronchiole. This is known as bronchoconstriction. So this is pathophysiology of bronchial asthma. Let's talk about the drugs. Which medicines will act on this pathway? So we have a drug which is inhibitor of this IgE. The drug which is inhibitor of IgE, the drug name is omalizumab. So we have a medicine which is omalizumab. So omalizumab is a medicine which is IgE inhibitor. The drug name is omalizumab. So omalizumab is a drug which is having the word mab. Mab का मतलब होता है monoclonal antibody. So this medicine is monoclonal antibody. This medicine is monoclonal antibody. So this medicine is monoclonal antibody. We call it mab, monoclonal antibody. The drug is omalizumab. M का मतलब है monoclonal, AB stands for antibody. So it's omalizumab is a IgE inhibitor. It's a monoclonal antibody against IgE. So some students remember like this way. They read like this way, OMAL. So they said OMAL. So they are pointing towards someone who is a mal. So they are saying OMAL. So OMAL is a IgE inhibitor. IgE inhibitor. So OMALI is a IgE inhibitor. It's a monoclonal antibody. Not a good mnemonic, but make your own mnemonics if possible. Next is the medicines inhibitor of phospholipase A2. So medicines which are inhibitor of phospholipase A2, we call them steroids. So steroids are the medicines which are inhibitor of phospholipase A2, and these steroids are given by inhalational route. Steroids are given by inhalational route. We call them ICS. We call them inhalational corticosteroids. Inhalational corticosteroids are inhibitor of phospholipase A2. Then we have a drug which is lipoxygenase enzyme inhibitor. The drug is lipoxygenase enzyme inhibitor. The drug name is xylitol. So xylitol is a drug which is lipoxygenase enzyme inhibitor. So lipoxygenase enzyme inhibitor, the drug name is xylitol. Now we have a drug which is inhibitor of mast cells release, inhibitor of leukotriene release. So there is a drug which is inhibitor of leukotriene release inhibitors. So medicines which are inhibitor of leukotriene release, we call them mast cell stabilizers. We call them mast cell stabilizers. So mast cell stabilizers are the medicines which inhibit the release of leukotrienes. Inhibit the release of leukotrienes from the mast cells. Now we have some drugs which are inhibitor of leukotriene receptors. So leukotriene receptor inhibitor, there is a drug, the drug name is montelukast. So montelukast is a medicine. Montelukast is a medicine which is inhibitor of leukotriene receptor. So xylitol is inhibitor of leukotriene synthesis, and mast cell stabilizers are inhibitor of leukotriene release, and montelukast is inhibitor of leukotriene receptor. The last group of medicines are medicines which are inhibitor of this bronchoconstriction. We call them bronchodilators. The last group of medicine is known as bronchodilators. So bronchodilators will cause bronchorelaxation and give the relief. So these are the drugs basically. These are the drugs which we have to cover in this topic of bronchial asthma. So again I am repeating the drug names. The first drug is omalizumab. Omalizumab is a monoclonal antibody which is IgE inhibitor. Steroids are phospholipase A2 inhibitor. Xylitol is LOX inhibitor. Mast cell stabilizers are leukotriene release inhibitor. Montelukast is leukotriene receptor inhibitor, and bronchodilators will give the relief by inhibiting the bronchospasms. So let's start with these medicines one by one. Let's start with these medicines one by one. The first group of medicine is known as steroids. The first group of medicines are known as steroids. And please remember, steroids are considered as drug of choice for maintenance treatment of bronchial asthma. Steroids are the best medicines for bronchial asthma. maintenance treatment of bronchial asthma. Nothing can be better than steroids. And steroids for bronchial asthma mainly given by inhalational route. So steroids are mainly given by inhalational route, and the medicines which belong to this class, medicines names are beclomethasone, budesonide, cyclesonide, and fluticasone. So medicines which belong to this class, medicines names are beclomethasone, budesonide, cyclesonide, and fluticasone. So these are the names, right? So some students make the mnemonic like this way: FBBC. So FB is Facebook, BC is I don't know what, BC is biochemistry. Maybe they study biochemistry on Facebook, so they make the mnemonic Facebook BC, right? And some students make the mnemonic in Hindi, if you understand Hindi, like they take the word Buddha. So Buddha is for Buddha. Buddha means old person in Hindi. So Buddha sitting on the back seat of cycle. So Buddha sitting on the back seat of cycle playing the flute. So they make the mnemonic Buddha on back seat of cycle playing the flute. So Buddha stands for budesonide. Buddha is for Buddha Admi, means the old person. So Buddha sitting on the back seat. Back is for beclomethasone of cycle. Cycle is cyclesonide. Playing the flute. Flute is for fluticasone. So make any mnemonic: beclomethasone, budesonide, cyclesonide, fluticasone. So these are the medicines which are given by inhalational route, and these medicines are given for bronchial asthma. So make any mnemonic, whatever you want. It's totally up to you, right? Now, whenever we give steroids to a patient by inhalational route, these steroids can lead to some side effects. Now, what are the side effects of steroids? So please remember the most common side effect. The most common side effect of steroid is oral candidiasis. We also call it oral thrush. So please remember, whenever we give steroids to a patient, we use the inhaler, and when we give this inhaler in buccal cavity, I hope you know this point, कि inhalers are given in buccal cavity. So steroids will deposit in your buccal cavity. Steroids will deposit in your buccal cavity. आपने drug तो लिया था bronchioles के लिए, but some of the steroid will deposit in your buccal cavity, and these steroids will interfere with the immune system of your buccal cavity. तो buccal cavity का जो immune system है, that is interfered, because we discussed already, steroids have anti-inflammatory and immunosuppressant property. So these steroids interfere with the immune system of the buccal cavity, can lead to infection like oral candidiasis, oral thrush. They will ask you the question, how you can prevent this side effect. So please remember, we can prevent this side effect by using a device known as spacer, or we can also suggest patient to go for mouth rinsing. So mouth rinsing is advisable after intake of drug. So we suggest patient to go for mouth rinsing after intake of drug, or patient can also take medicine with the help of a spacer. Now what is spacer? As the name suggests, spacer, this will just create a space between you and the drug, right? So like this is the patient, if I say this is the patient, right? So this patient will use this spacer. So this is a device, we call it spacer, and this is the inhaler. So this is the drug, so I'm labeling as D. So D stands for drug. So this is your drug and this is your patient. P is for patient. So we have created a space between two. So this device is known as spacer. Now what is the advantage of this spacer? It is just a plastic pipe. It's nothing special in this, just a plastic pipe, right? So what will happen when you use this plastic pipe between the inhaler and the mouth? Whatever are the heavy particles, whatever are the large particle of steroids which normally deposit in your buccal cavity, now these heavy particles and the large particles will deposit in this spacer. The heavy particles and the large particles will deposit in the spacer. Only the fine particles will reach up till the buccal cavity. So these fine particles will not deposit, they will directly go to the bronchioles, and therefore we can prevent the side effect of candidiasis in the patient who is taking steroid for rest of his life due to bronchial asthma. So bronchial asthma mein, if any patient is taking steroid, always there is a risk of oral candidiasis, and because of the risk of oral candidiasis, we have to prevent this side effect, and we can use a spacer in between the drug and the patient mouth, which will prevent this side effect. And also we tell patient that whenever he will take the medicine, he has to rinse his mouth. so that the whatever drug is there, that drug will also be washed off. Now these steroids which will deposit in buccal cavity can cause oral candidiasis. Now the same steroids when deposit in your vocal cords. So steroids will deposit over vocal cords, and when the steroids will deposit over vocal cords, steroids can change the anatomy and the histology of vocal cords, not anatomy, histology. So steroids will change the histology of vocal cords. So vocal cord cells cannot multiply properly. Vocal cord cells have lot of changes due to the steroid presence over there, and that will cause change of voice. The steroid will deposit over vocal cord, that will cause change of voice and difficulty in speaking. We call it dysphonia. So change of voice, dysphonia, we also call it hoarseness of voice. So patient voice will be changed, we call it hoarseness of voice. So medicine can cause hoarseness of voice as a long-term side effect. So the long-term side effect is medicine can cause hoarseness of voice. It will deposit over vocal cords. Now there are some systemic side effects also. Please remember, whenever we give steroids to a patient, we give inhaler in buccal cavity. So we want that medicine should go to the larynx only, right? But problem क्या होती है? We are putting the medicine in pharynx. तो pharynx और larynx का connection is common. I hope you know this point. अगर ये front वाला pharynx है, तो पीछे वाला larynx है, right? So you expect that medicine should go to the larynx, but होता क्या है कि some of the medicine will also go to the pharynx. Some of the medicine will also go to the pharynx, right? And that and if the medicine that has gone to the pharynx, that will enter in your GIT system, and medicine is absorbed from your GIT. And when this medicine is absorbed from your GIT, this will lead to systemic side effects. अब वो मेडिसिन डेली एब्जॉर्ब हो रहा है, तो द मेडिसिन इज गेटिंग एब्जॉर्ब फ्रॉम योर जीआईटी ऑन डेली बेसिस, ऑल्दो द क्वांटिटी इज वेरी वेरी लेस. द इनहेलेशनल रूट क्वांटिटी विच इज रीचिंग द जीआईटी इज वेरी वेरी लेस, बट एवरी टाइम इट इज रीचिंग. So after 10 to 15 years क्या होगा? After 10 to 15 years you will start seeing the side effect of steroids in the patient body. So all organs of the patient body will start going to be affected after many years of therapy, and they will ask you what are the side effects of steroids. So please remember, if I discuss the side effects of steroids, please remember, if this is the patient, स्टेरॉइड्स का एक टेंडेंसी है, देयर इज अ वन टेंडेंसी ऑफ स्टेरॉइड्स विल ऑलवेज प्रिजर्व दोज पार्ट्स ऑफ द बॉडी विच आर एसेंशियल फॉर सर्वाइवल. Steroids will always preserve those parts of the body which are essential for survival, and if you give steroids, the other parts of the body which are not essential for survival are neglected, right? So please remember, as a general rule, जो आपका central axis है body का, this portion is important for survival. So your brain is important for survival, your GIT is important for survival, your heart is important for survival, your BP is important for survival. So all the central structures of your body are important for survival, but the peripheries are not required for survival. You can live without the limbs. You can live without upper limb, you can live without lower limb, but you cannot live without your heart, without your lungs, without your brain or without your GIT. Understood? So steroids जो कि stress hormones हैं, when you are giving it from outside, now you are using steroids as a drug from outside, these steroids will try to preserve the central part, right? So the central part of the body will be stimulated, but the peripheries of the body will be inhibited. It's very simple rule. Central part में जो structure होगा, that is stimulated, but the peripheries of the body will be inhibited. So let's talk about CNS. So what will happen in CNS? Please remember, CNS में patient का patient mood will be elevated. So patient will not have depression, patient will have psychosis. So patient will have psychosis, not the depression. Patient will have raised ICT, so intracranial tension will be more, right? Plus patient will have overactivity of nerves that will cause seizures. So there is no sedation here. Sedation नहीं होगा, depression नहीं होगा. So CNS will remain stimulated, patient will have psychosis, raised ICT, and patient can also have seizures, right? If we talk about eyes, there is a rapid aging. There is a rapid aging of lens. So there is a rapid aging of lens. So lens का जो age होगा फटाफट बढ़ेगा, it will start increasing, and that will cause cataract. So that will cause cataract. We call it posterior subcapsular cataract. That is known as posterior subcapsular cataract. So steroids will result in posterior subcapsular cataract in our eyes. And steroids can also result in raised intraocular pressure. So there is raised intraocular pressure as a side effect. So steroids can also cause glaucoma. So steroids can cause glaucoma, steroids can cause cataract as a side effect. So eyes, maybe everything is stimulated because the eye will come in the central part. If we talk about musculoskeletal system, if we talk about your muscles and the bones, so please remember muscles and bones are present in periphery, right? So these parts are neglected. So bones are neglected because bones are part of your limbs. So there is a osteoporosis. So patient will develop osteoporosis, patient will develop hypocalcemia, patient will develop muscle atrophy. So patient will have muscle atrophy. So patient will have muscle atrophy, hypocalcemia and osteoporosis, right? If we talk about cardiovascular system means the central part, the heart. The heart is stimulated, so patient will have tachycardias, patient will have arrhythmias, patient will have high blood pressure. So patient will have high blood pressure, arrhythmias, and tachycardias. If we talk about GIT, there is an increased acid, and because of this high acid, this will result in increased peptic ulcer disease. This will result in increased risk of peptic ulcer disease. When we talk about metabolic complication, steroids will cause hyperglycemia. So in the central of the body, in your circulation, the glucose level will increase, and thus fat will deposit in the central part. The fat will deposit in the central part, we call it central obesity. So when this fat will deposit on your face, we call it moon face. When the fat will deposit on your shoulder, we call it buffalo hump. So moon face, buffalo hump, all these are side effects, right? So we have muscle atrophy, we have skin atrophy. Skin is also not required for survival. So we have skin atrophy in the body. So skin atrophy, so we call it stry. The patient will have rashes on the skin, the stretch marks on the skin, the stry will be there. Skin is very fragile, the skin atrophy. And if you can remember, it's fine, otherwise it's not very important for your exam. HPA axis. HPA axis full form is hypothalamic pituitary adrenal axis. So hypothalamic pituitary adrenal axis will be suppressed. So the main purpose of hypothalamus and pituitary is to form steroids, and the same steroids you are giving from outside. And when you give steroids from outside, if you give steroids from outside, these steroids will give feedback inhibition. So this will give feedback inhibition, negative feedback to HPA axis. So HPA axis will be suppressed. So these are the side effects of steroids. So I am giving you 2 or 3 minutes to memorize the side effect of steroids because this topic is very, very important. So take 2 to 3 minutes. Try to mug up the side effects of steroids. Till that time, I will have the water. Right? Then I'll ask you these questions, right? Right. So I hope you have mugged up all the side effects of steroids. Now after that, if we talk about other medicines of this group, so first group of bronchial asthma drug we have covered. The medicines are known as steroids. They are the drug of choice for bronchial asthma, steroids given by inhalational route. Medicines names are beclomethasone, budesonide, cyclosonide, fluticasone. Side effect of steroids, the most common side effect is oral candidiasis. Second side effect is change of voice and dysphonia. CNS side effects are psychosis, raised ICT and seizures. Eyes में होगा cataract and glaucoma both. Musculoskeletal system, it will cause osteoporosis, hypocalcemia, muscle and skin atrophy. HPA axis will be suppressed. Metabolic side effects are hyperglycemia and central deposition of fat. Cardiovascular system, it will cause tachycardia, arrhythmia and high blood pressure. And GIT side effects are peptic ulcer disease. What is the side effect? One question is asked by a student. What is the side effect of steroid on renal system? So please remember, in renal system, if I talk about renal system, so these steroids will act as mineralocorticoid. So you must be knowing there are two types of steroid, glucocorticoid and mineralocorticoid. So these steroids will act like mineralocorticoid and can result in retention of sodium and water. So kidney will also work more. So sodium and water will be retained. So in kidney, this will retain sodium and water and that will eventually cause high blood pressure. So in जो हमने ये लिखा था ना, high blood pressure, this is due to this. So in cardiovascular system, the BP is raised due to this kidney effect. So steroids will lead to increased retention of sodium and water and that will cause high blood pressure. So this is the reason for high blood pressure, right? Next is leukotriene pathway inhibitors. Now here you have to understand few things, because यहाँ पे ना drugs are very easy. Leukotriene pathway inhibitors, drugs are easy, no problem in drugs. The only problem is during the exam time you get confused. So please be careful while remembering the drugs. The first drug is LOX inhibitor. The drug name is Xelutan. So we have a drug, the drug name is Xelutan. So if you look at the name of this medicine carefully, this medicine is having the word leukotriene. Medicine is having the word leukotriene, and before this leukotriene word there is a word I. So it's an inhibitor. This medicine is inhibitor of leukotriene on effect. Medicines are inhibitor of leukotriene on effect. So medicine is inhibitor of leukotriene on effect. So leukotriene on effect is blocked. It means this medicine is leukotriene synthesis inhibitor. This medicine is leukotriene synthesis inhibitor. The drug name is Xelutan. So this is important. Like in exam, you people get confused, like which one is synthesis inhibitor, which one is receptor inhibitor, which one is release inhibitor. So this is leukotriene synthesis inhibitor. But if I ask you this question, which medicines are leukotriene receptor inhibitor? We have two medicines over here. Medicine name is montelukast. So medicine name is montelukast. Number two drug is zefirlukast. So montelukast and zefirlukast are two medicines which are leukotriene receptor inhibitor. So again these medicines are having the word leukotrienes. So these medicines will act on leukotriene pathway, but these medicines are receptor inhibitor. So montelukast, zefirlukast are receptor inhibitors, right? The last is medicines which are leukotriene release inhibitors. So leukotriene release inhibitors are mast cell stabilizers. These medicines are mast cell stabilizers, and all medicines which have the word chromo in their name. Any medicine which has the word chrome, not chromo, chromo. Any medicine which has the word chrome in its name is a mast cell stabilizer. For example, the drug name is sodium chromoglycate. Medicine का नाम है sodium chromoglycate. One more drug is nidochromyl sodium. Nidochromyl sodium. So any medicine which has the word chrome, any medicine which has the word chrome is a mast cell stabilizer. Please remember, mast cell is a colorful cell. Under a microscope, if you have ever seen in the slides of pathology, so in pathology lecture, sir must have shown you the mast cell slides. So if we talk about mast cell slides, mast cells are colorful cells. Mast cells are colorful cells, and colorful means chrome. Chrome का मतलब है colorful. So mast cell stabilizers are colorful cells. They are act on the colorful cells. Medicines are sodium chromoglycate and nidochromyl sodium. So three medicines, one is leukotriene synthesis inhibitor, one is leukotriene release inhibitor, and one is leukotriene receptor inhibitors. The third group of medicine is monoclonal antibody. So monoclonal antibody given for bronchial asthma. The name of the medicine we have already covered. Now I request you to send me the name of this medicine. What is the name of this medicine? Only then you will remember. More you pronounce the name of these drugs, more you try to speak out the name of these drugs, more you can remember. Otherwise these drugs names are very confusing, very volatile. Pharma में ना एक ही problem है, the drug names. Drug name is the only problem. Concept of the pharma is very easy, very straightforward, very interesting also. Problem आता है drug के names में. Yes, the drug name is omalizumab. So medicine name is omalizumab. Omalizumab is a medicine. Omalizumab is a medicine. This is IgE inhibitor. This is IgE inhibitor. Right? Montelukast का कोई भी साइड इफेक्ट नहीं है. There is no significant side effect of Montelukast as asked by one student. There is no significant side effect of Montelukast. It's a very good drug. Any idea doctors, Montelukast given by which route? Montelukast को किस रूट से लेते हैं? Oral route और inhalational route और IV route? Oral route or inhalational route or IV route? Any idea about the route of administration of Montelukast? Very good. So these medicines are taken by oral route. These medicines are taken by oral route. Medicines are taken by oral route and medicines have slow onset of action. Medicines have slow onset of action. Medicines have slow onset of action. Medicines are given by oral route. So these drugs are given by oral route. Montelukast given by oral route and having the slow onset of action. So medicines have no role in treatment of acute bronchial asthma. Medicine is given by oral route. There are many brands available in the market. You must have known about this brand. Monter is one more brand. Monter, Montec, all these are brand names of Montelukast. Right? Okay, now come to the bronchodilators. The last group of medicine for bronchial asthma is bronchodilators. Now bronchodilators are given for symptomatic relief. Now two group of bronchodilators we have discussed already. One student has asked the question, Montelukast से sleepiness नहीं होता boss. Montelukast will not cause sleepiness. But problem is Montelukast is available in market in combination with anti-allergics like levocetirizine. It is available in combination with levocetirizine or fexofenadine, which are anti-allergic medicine. So if you take that combination of Montelukast with anti-allergic drug, that will cause sedation. So anti-allergics will cause sedation, Montelukast will not cause. So if you take plain Montelukast, no sedation. If you take Montelukast with anti-allergics, definitely there is sedation. Bronchial asthma में एक ही monoclonal antibody है. In bronchial asthma, there is only one monoclonal antibody for your exam. And for AIMS exam, we have 7 or 8 more. But for your exam, omalizumab is the only answer, right? So omalizumab is a drug which we use for bronchial asthma, right? Right. Next is, no, there is no contraindication of Montelukast. Montelukast का कोई भी contraindication नहीं है. There is no contraindication of Montelukast. Very good drug medicine. The only problem with Montelukast is, guys, medicine has slow onset. Medicine efficiency is not that much like steroids. Steroid की तरह नहीं है ये. Medicine is a low efficiency drug. So for mild symptom, this medicine is wonderful. If you have mild symptoms of bronchospasm, you have mild bronchitis because of common cold, you can take this medicine without any problem. You can take it for 15 days, 20 days, 30 days, no problem at all. So only problem is during the acute attack, medicine cannot control the symptom because medicine has slow onset, and for severe bronchial asthma, medicine has limited utility. Right? Next is bronchodilator. So which medicines are bronchodilator? The first group of medicine is SAMA and LAMA. So these medicines are muscarinic receptor inhibitor. The medicines are SAMA and LAMA. SAMA, LAMA are two medicines which we have already covered. Now who will tell me what are the examples of SAMA and what are the examples of LAMA? But before that, you people are asking so many questions on Montelukast. Let me answer those questions. No doctor, Montelukast mein there is no dependency. Montelukast में there is no risk of any addiction. Omalizumab. Doctor, omalizumab is a drug. It is not commonly prescribed. There are three reasons for that. First reason is omalizumab cannot be given by oral route. पहला problem ये है, omalizumab cannot be given by oral route. Number two reason, this is very costly medicine. Number three reason is this medicine, because of its high efficiency, it is only given in steroid refractory cases. तो ऐसा bronchial asthma जो steroid refractory है, there we give omalizumab. Otherwise omalizumab is not the drug which we use commonly in OPD, right? This is the reason. Amitabh Bachchan used to take this medicine. Amitabh Bachchan लेता है omalizumab. He is suffering from bronchial asthma, so he takes omalizumab. Right? Yes. So now we are discussing examples of SAMA and LAMA. So SAMA and LAMA are anticholinergic drugs, and we discussed that any medicine which is anticholinergic, any medicine which is anticholinergic, any medicine which is anticholinergic having the word atropine in its name. So medicine is having the word atropine in its name. So medicines are ipratropium and tiotropium. So ipratropium and tiotropium are two medicines which are muscarinic receptor inhibitor. Muscarinic receptor inhibitors are ipratropium and tiotropium, and we discussed already ipratropium can lead to one side effect of dry mouth, but tiotropium is a drug. Tiotropium is a drug which has no side effect. So tiotropium has no side effect, but ipratropium can cause dry mouth. So many of you have given the correct answer. Dr. Princey has given the correct answer, and Dr. Sama, Sama is the group name, not the doctor name. Dr. Kishan has given the correct answer. Unnati has given the correct answer. So these are the SAMA and LAMA. So this group we have already covered, so kindly refer your notes. Next is, there is one more group of medicine that we have already covered, the SABA and LABA. Okay, who will tell me what is the full form of SABA and LABA? What is the full form of SABA and LABA? And also tell me the names of drugs which are SABA and LABA. What are the names of medicines which are SABA and LABA? And what is the full form of SABA and LABA? Full form is very good. So one doctor has given the answer, short and long acting beta agonist. But which beta, doctor? Beta 1 or beta 2? Beta 1 or beta 2 agonist? Anyone would like to answer? These medicines are beta 1 agonist or beta 2 agonist? Short acting, long acting, beta, which beta? Beta 2 agonist. Very good. So these medicines are short and long acting beta 2 agonist. So these medicines are short and long acting beta 2 agonist. The medicines are SABA and LABA. What are the examples of SABA and LABA? Yes, any drug which has the word buta. Any medicine which has the word buta is SABA. Any drug which has the word metro is LABA. So metro drugs are LABA and buta drugs are SABA. So Dr. Nalin, very good. Dr. Shikha, all of you have given the correct answer. Many of you have given the correct answer. Aryan has given correct answer. So I cannot because I am receiving 100 messages at a time, so it's difficult to take names of all students. So SABA and LABA, salbutamol, terbutaline, and long-acting beta-2 agonist are salmetrol and formoterol. Okay, now who will tell me? Now there is one more question for you people. Who will tell me what are the 6 side effects of salbutamol? What are the side effects? 6 side effects of salbutamol. What are the 6 side effects of salbutamol? Dr. Mubha, would you like to try? What are the 6 side effects of salbutamol? Very good. So you have So Anukul has sent me a voice message for side effects of salbutamol.
The three side effects of beta 2 agonist are mainly 3T and 3H, which are tremors, tachycardia, tolerance, and 3H is hypokalemia, hyperglycemia, and hypotension.
So Anukul has given all correct answer. Good, Anukul, very good. So many of you have given the correct answer: tremors, tachycardia, tolerance, hypokalemia, hyperglycemia, and hypotension. Right? So these are the side effects. Now come to the medicine, which are the other bronchodilators. So if we talk about other bronchodilators, the drug is magnesium sulfate. The drug is magnesium sulfate. Now please remember, whenever we give magnesium sulfate to a patient, body cannot differentiate between magnesium and calcium. Body cannot differentiate between magnesium and calcium. And when body cannot differentiate between magnesium and calcium, if you give magnesium, this will block the calcium entry. So if you give magnesium, this will block the calcium entry in bronchiole. So this will block the calcium entry in bronchioles. And when calcium cannot take entry in bronchioles, these bronchioles will be dilated. So bronchodilation will take place. Right? So magnesium sulfate gives or donates magnesium, and body cannot differentiate between magnesium and calcium ion. So magnesium will go and block the calcium entry point in a muscle. Now calcium entry is not possible. Now the bronchioles cannot contract, and when these bronchioles cannot contract, this will cause bronchodilation. This is how magnesium sulfate will act. Now the other point about magnesium sulfate is a medicine which is always given by IV route. Magnesium sulfate is a medicine which is always given by IV route, and this medicine is typically useful for the treatment of acute severe bronchial asthma. This medicine is given for the treatment of acute severe bronchial asthma. So this medicine is given only for acute severe cases of bronchial asthma. The drug is magnesium sulfate. So magnesium sulfate is a drug which is given for acute severe bronchial asthma, and this medicine was asked in one of the option of your MCQ in June 2022 exam. So June 2022 exam, they asked which medicine is not given for acute bronchial asthma. Which medicine is not given for acute bronchial asthma, and one of the option was montelukast. So montelukast is not given for acute bronchial asthma because of the slow onset. Montelukast is not given for bronchial asthma, acute bronchial asthma, because of slow onset, right? But magnesium sulfate is a drug which has very fast onset of action. It is given for acute severe bronchial asthma by IV route. Now the last bronchodilator is theophylline. Then this topic is over. So drug is theophylline. Now this is also very important drug. So every year you get 1 or 2 MCQs from bronchial asthma. Every year you get 1 or 2 MCQ. This year you got 3 MCQs from bronchial asthma topic. So theophylline is an important drug for your exam. Now this medicine is methylxanthine. The group name of the theophylline is methylxanthine, and these medicines are originated. Theophylline is a drug which we have obtained from tea and coffee. So theophylline is a drug which we have obtained from tea and coffee. So we have obtained this medicine from tea and coffee. So whenever you people consume tea and coffee, you get mild bronchodilation and you get relief in the symptoms of common cold and bronchial asthma. So tea and coffee is a bronchodilator, and these tea and coffee will give relief in symptoms of bronchial asthma as well as common cold. Now we will discuss how this tea and coffee can give us the bronchodilation, can give us the relief. So this is very important. Theophylline is phosphodiesterase enzyme inhibitor. The main mechanism of action of this medicine is it is inhibitor of one enzyme. The name of the enzyme is phosphodiesterase enzyme. So this is inhibitor of phosphodiesterase enzyme. So P stands for phospho, D stands for diesterase enzyme. So this medicine is inhibitor of phosphodiesterase enzyme, and by blocking this phosphodiesterase enzyme, this medicine can increase the level of cyclic AMP. Doctors, please remember one thing. In human body, there are two secondary messengers. There are two chemicals. One is known as cyclic AMP, second is known as cyclic GMP. So A means adenine, G means guanine. So in this AMP and GMP, A means adenine, G means guanine, they are interchangeable. So at any point of time, cyclic AMP becomes cyclic GMP and cyclic GMP becomes cyclic AMP. So both are almost same. So please remember, in human body, cyclic AMP and cyclic GMP are metabolized by this enzyme. The name of the enzyme is phosphodiesterase enzyme, and theophylline is a drug which is blocker of this phosphodiesterase enzyme. So theophylline is a medicine which is blocker of this phosphodiesterase enzyme, and by blocking this phosphodiesterase enzyme, the medicine will increase cyclic AMP level. Medicine will increase cyclic AMP level in bronchial muscles, and when you increase cyclic AMP level in bronchial muscle, this will cause bronchodilation. So this is the main mechanism of action of theophylline. It's a phosphodiesterase enzyme inhibitor. So this medicine is phosphodiesterase enzyme inhibitor, increase the level of cyclic AMP in bronchioles and causes bronchodilation. Now there is one more mechanism of action of this drug. This medicine is adenosine receptor blocker. This medicine is adenosine receptor blocker. Medicine can also block adenosine receptor. Sorry for this misprints, because there is a lot of mistakes in spellings. So I think printer is not very comfortable with drug names. So adenosine receptor blocker. So this medicine is also adenosine receptor blocker. So this medicine block adenosine receptor and can result in bronchodilation. So there are two mechanisms of action of this medicine. One is inhibition of phosphodiesterase enzyme as well as blocker of adenosine receptor. Right, so please remember this point. This is very important mechanism of action. I don't know why, but students mostly forget about this theophylline mechanism of action, but this is very important for your exam. Right, now what are the side effects of theophylline? So please remember, theophylline side effects are same like if you have consumed 30 cups of coffee and tea. Now who will tell me what can be the side effect you can think of when you consume 30 cups of coffee and tea? Assume you have consumed 30 cups of coffee and tea. What all side effect you can expect in your body? What all side effects you can expect in your body after consumption of 30 cups of coffee and tea? Anyone? At least answer one or two side effect. Very good. अरे one doctor has answered drowsiness. अरे doctor क्या बोल रहे हो? After having tea and coffee, you will have drowsiness. Think something else. Very good. So most of you have given the correct answer. After having 30 cups of coffee and tea, you can have nausea and vomiting. So you can have nausea and vomiting as a side effect. So nausea, vomiting is the most common side effect. You can also have insomnia. You can also have insomnia. You will have diuresis. You have increased urine output, that is diuresis. And you will also have tachycardias. So you will have tachycardias, you will have insomnia, diuresis. All these side effects can occur. So patient can have nausea, vomiting, insomnia, diuresis, tachycardia. All these things can occur as a side effect. So all these are side effects. Insomnia, diuresis, tachycardia, nausea, vomiting. All these things can occur if you consume. Yes, less sleep. Less sleep is definitely a side effect, insomnia. So these are the side effects of this medicine, right? That is theophylline. Now after the side effects of theophylline, we can discuss some of its property which can be asked in the exam. So if we talk about its properties of theophylline, please remember this medicine is metabolized by liver. This medicine is metabolized by liver. The drug is metabolized by liver, right? So theophylline or the tea and coffee metabolized in your liver. Now if you are taking theophylline with some liver enzyme inducer drugs, so there are some medicines which are inducer of liver enzymes, and so this drug is metabolized by liver enzymes, and there are some drugs which are inducer of liver enzymes. Some medicines are inhibitor of liver enzymes. So any drug which is inducer of liver enzyme, any medicine which is inducer of liver enzyme induces the metabolism of theophylline, in the body, and that will lead to This will induce the metabolism of theophylline in the body that will lead to failure of your treatment. So that will lead to more metabolism, fast metabolism of theophylline. Because of fast metabolism and the more metabolism of theophylline, this results in your bronchial asthma treatment failure. Assume आपने patient को दिया theophylline, and when this theophylline is given to patient is taking some other drug, and that medicine is inducer of liver enzyme. And if you induce the liver enzyme, then theophylline metabolism become very fast. So before causing any bronchodilation, before inducing any bronchodilation, theophylline is metabolized. That will lead to treatment failure. But if you take theophylline with enzyme inhibitor, if you take theophylline with a drug which is liver enzyme inhibitor, so this medicine which is liver enzyme inhibitor can inhibit, this medicine can inhibit the metabolism of theophylline. And because this medicine can inhibit the metabolism of theophylline, so theophylline will accumulate in the body. So theophylline concentration is increased in the body, and if the theophylline concentration will increase in the body, this will result in toxicity as a problem. So if you take theophylline with enzyme inducer, there is a risk of treatment failure. If you take theophylline with a drug which is liver enzyme inhibitor, there is a risk of theophylline toxicity. So they will ask you this question. Which medicines are liver enzyme inducer? Which medicines are liver enzyme inhibitors? So you should be knowing the medicine names which are liver enzyme inducers and liver enzyme inhibitors. Right? So which factors are liver enzyme inducer? Which factors are liver enzyme inhibitor? So there is one topic in your book, that is general pharma. So I suggest you to go to the general pharma. So open the general pharma. The page number is 142. The page number is 142. So page number is 142. On this page number 142, we have a table given. So this topic of general pharma, we should be knowing all drugs which are liver enzyme inducers and liver enzyme inhibitors. So which medicines are liver enzyme inducers and inhibitors? Medicines which are liver enzyme inducers and inhibitors we'll discuss here. Right? So please remember, the drugs which are liver enzyme inducer, the mnemonic for this is car gas. The mnemonic is car gas. In this car gas, C stands for corticosteroids. So corticosteroids are liver enzyme inducer. Corticosteroid means only steroids, you can write. So corticosteroids, steroids is same thing like prednisolone, dexamethasone. All these are liver enzyme inducers. So corticosteroids are liver enzyme inducers. C stands for corticosteroids. A stands for anti-epileptic drugs. So please remember, anti-epileptic drugs are liver enzyme inducers. Anti-epileptics are liver enzyme inducer like phenytoin. So phenytoin is anti-epileptic which is liver enzyme inducer. One more anti-epileptic is carbamazepine. Carbamazepine is also liver enzyme inducer. One more anti-epileptic is phenobarbital. We also call it barbiturate. So barbiturates like phenobarbital, carbamazepine, phenytoin, these are liver enzyme inducer. One TB drug, the name is rifampicin. So one TB drug, the name is rifampicin, it's a liver enzyme inducer. One antifungal drug is griseofulvin. The medicine name is griseofulvin. So griseofulvin is one more drug. Griseofulvin is one more drug which is liver enzyme inducer. Fifth is your favorite medicine, alcohol, and S is for the second favorite, smoking. So liver enzyme inducers are corticosteroids. Mnemonic is car gas. Corticosteroids. A stands for anti-epileptic drugs. A stands for anti-epileptic drugs like phenytoin, carbamazepine, and phenobarbital. Phenytoin, carbamazepine, and phenobarbital. The R stands for rifampicin. R stands for rifampicin. G stands for griseofulvin. G stands for griseofulvin. A stands for alcohol. A stands for alcohol, and S stands for smoking. Now coming to the medicines which are liver enzyme inhibitor. medicines which are liver enzyme inhibitor. So for the medicines which are liver enzyme inhibitor, we can remember a mnemonic. You can make any mnemonic. One mnemonic is special peacock. So one very special mnemonic, special peacock. In this mnemonic of special peacock, the medicines names are sodium valproate. Now please remember, sodium valproate is the only drug, only antiepileptic which is liver enzyme inhibitor. Sodium valproate starts from S. It's the only antiepileptic which is liver enzyme inhibitor. P stands for protease inhibitors. P stands for protease inhibitors. So protease inhibitors are the drugs which are given for the treatment of HIV. E stands for one antibiotic. The name of the antibiotic also include clarithromycin. So three antibiotics will start with alphabet C: ciprofloxacin, clindamycin, clarithromycin. Next is omeprazole, omeprazole. Next is cimetidine, and the last is ketoconazole. So the mnemonic is special peacock, right? So in this mnemonic of special peacock, sodium valproate. So S stands for sodium valproate. S is for sodium valproate. P stands for protease inhibitors. E stands for erythromycin. A stands for allopurinol. Next, C stands for all antibiotics which start with alphabet C except cephalosporins. All antibiotics which starts with alphabet C except cephalosporins. O stands for proton pump inhibitor, that is omeprazole. Next, C stands for cimetidine and K stands for ketoconazole. So for inducers we have a mnemonic car gas, and for inhibitor we have a mnemonic peacocks, a special peacock, whatever you want to remember, right? So now take 2 or 3 minutes, or let it be 3 or 4 minutes, and try to mug up the side effects of steroids which we discussed already, as well as mug up the medicines which are liver enzyme inducers and inhibitors. So take your time, try to mug up these inducers and inhibitors, as well as revise the side effects of steroids. Side effects of steroids are very important, right? Okay, so these are the enzyme inducers and inhibitors, and also we have revised the side effects of steroids. Now go back to the same page. So we were discussing about this theophylline, and we had discussed that theophylline has lot of drug interactions, right? So medicine has lot of drug interactions with, and you should be knowing the medicines which are liver enzyme inducers and inhibitor. Now we will discuss the second property of the drug. The second property of the medicine is medicine has low therapeutic index. Medicine therapeutic index is low. So medicine therapeutic index is low. It means the medicine has narrow safety margin. So what is therapeutic index? The therapeutic index is a safety margin. Therapeutic index is a safety margin. So medicines have narrow safety margin. Medicine has narrow safety margin. So low therapeutic index, medicines have narrow safety margin. And because of this narrow safety margin, there is a risk of toxicity. So medicine has narrow safety margin associated with more risk of toxicity. And because of this more risk of toxicity, this medicine is always given with plasma concentration monitoring. Medicine has low therapeutic index. Therapeutic index means safety margin. The safety margin of this drug is very narrow, and because of the narrow safety margin, the risk of toxicity is high with this drug. And this medicine is always given with monitoring of its plasma concentration. So what is PCC? PCC stands for plasma concentration. So medicine is given with plasma concentration monitoring. The last point of this theophylline drug is, this point you have to just write down for a while. I will explain this point later on in general pharma. So please remember, all drugs in pharmacology follow a typical pattern during their elimination. So during the elimination of any drug in medical science, all medicines follow the same pattern, same rule, and that pattern is known as first order kinetics. But there are four medicines in medical science. There are four medicines in medical science which follow a different type of rule, different types of elimination pattern, and that is known as zero order kinetics. So please remember, theophylline is a drug which follow zero order kinetics for its elimination. So during its elimination, so during the time of elimination, this medicine follows zero order kinetics. What is zero order kinetics? What is first order kinetics? That we will cover in general pharma. For a time being, please write down the drug names. So which medicines follow zero order kinetics? The mnemonic is VEPT. So there are total four medicines which follow zero order kinetics. The first medicine is warfarin. Second medicine is your favorite drug, ethanol. टॉनिक भी बोलते हैं इसको, टॉनिक है ये इथेनॉल. सो वॉरफरिन, इथेनॉल, phenytoin, and the fourth one is theophylline. So these are the four medicines which follow zero order kinetics: warfarin, ethanol, phenytoin, and theophylline. These four medicines follow zero order kinetics. The mnemonic is VEPT. That is all about the drugs which are given for bronchial asthma. We have covered all these medicines. If we go back the classification, this is the classification of drugs. So omalizumab is IgE inhibitor. Omalizumab is IgE inhibitor given by subcutaneous route. We have discussed during our one of the discussion. Steroids, there are four steroids like beclomethasone, budesonide, cyclosonide, fluticasone, best medicines for maintenance treatment, and their side effects are very, very important for your exam. Now we have three medicines. One is leukotriene synthesis inhibitor. The drug is Xelutan by blocking the LOX enzyme. One is leukotriene release inhibitor. We call them mast cell stabilizer. And one is leukotriene receptor inhibitor. Medicines are montelukast and zafilokast. We have some medicines which are bronchodilators, and we discussed four types of bronchodilators today. The first bronchodilator we discussed was SAMA and LAMA, that is ipratropium and tiotropium bromide. The second we discussed was SABA and LAVA, that is salbutamol, terbutaline, salmeterol and all. Third we discussed was magnesium sulfate, which is a bronchodilator given by IV route for acute cases of bronchial asthma. And the last we have discussed a medicine which we have derived from tea and coffee. So tea and coffee में theobromine होता है, तो theobromine से we have developed the theophylline. So theobromine is a compound which is there in the tea and coffee. So we have derived this medicine from this theobromine. We call it theophylline. So this is all about bronchial asthma drugs. Now we will discuss the treatment of bronchial asthma. So if we talk about treatment of bronchial asthma, patient of bronchial asthma can come to you for acute attack of treatment. So treatment of acute attack of bronchial asthma, treatment for maintenance treatment of bronchial asthma. So for acute attack of bronchial asthma, these days we give a combination of formoterol. So we give a combination of formoterol plus budesonide. So budesonide is a inhalational corticosteroid. Budesonide is a inhalational corticosteroid and formoterol is a LABA. So we give this combination as a best treatment. It's a treatment of choice. TOC stands for treatment of choice. It's a best treatment for acute attack of bronchial asthma. Treatment of choice for acute attack of bronchial asthma, the medicine is formoterol plus budesonide combination. Or if it is not given to you, in MCQ, then you will go for salbutamol. As a best answer. So second treatment of choice is salbutamol. The first is formoterol plus budesonide. If it is not given to in MCQ, go for salbutamol. Now for maintenance treatment of bronchial asthma, you have to mark the best medicine as inhalational corticosteroids. So inhalational corticosteroids are the best medicines for maintenance treatment of bronchial asthma. And after giving steroids, if the bronchial asthma is not controlled, after giving inhalational steroids, you have to add LABA to the medicine. You have to add LABA to the above medication. So inhalational steroids not able to treat, add LABA, that is salmeterol or formoterol. So any drug which ends with the word, any medicine which has the word metro can be added in the treatment. Nowadays we prefer to add formoterol. But salmeterol is also a good option for maintenance treatment. This is for the treatment of bronchial asthma. Next is whenever patient will come to you with acute severe bronchial asthma. So acute severe bronchial asthma is also known as status asthmaticus. So acute severe bronchial asthma is also known as status asthmaticus. So for the treatment of acute severe bronchial asthma, we give mainly bronchodilators. So acute severe bronchial asthma is treated mainly by bronchodilators. So there are 4 groups of medicines which we use mainly here, and the 4 groups of medicines are, we discussed already, the SAMA. So we use bronchodilators which have fast onset. Medicines which have fast onset of action like SAMA, we can give SABA, we can give magnesium sulfate, and we can also give theophylline. So these are the 4 medicines which we can use here. So fast acting bronchodilators we give as the main drugs for status asthmaticus, like SAMA, short acting muscarinic antagonist, ipratropium. SABA drugs like salbutamol, terbutaline, magnesium sulfate given by IV route, theophylline we can also give by IV route. Number 2, plus minus, we can also give steroids. For the treatment, but there is no role of leukotriene receptor inhibitor. So there is no role of leukotriene pathway drugs. So no role of xyluton, no role of montelukast, no role of mast cell stabilizers for acute severe bronchial asthma. The last topic is COPD. So medicines which are given for COPD. So whenever patient of COPD like emphysema, so patient of emphysema has come to you for treatment. So for acute attack of COPD, please remember you will mark only salbutamol. So salbutamol is a drug of choice for acute attack of COPD. But for maintenance treatment, if they will ask you, so maintenance treatment of choice is LAMA, that is tiotropium bromide. So LAMA is a tiotropium bromide. It's a drug of choice for maintenance treatment of COPD. And if it is unable to control, you will add LABA. You will add LABA. You will add LABA to the treatment. And please remember, in the treatment of COPD, there is no role of steroids. There is no role of steroids, IgE inhibitors, and leukotriene pathway blockers. So these three group of medicines are not useful, right? So in patients of COPD, only bronchodilators are useful. Only bronchodilators are useful. Steroids and the other drugs are not useful. So only bronchodilators are given for COPD. This is all about the drug of choice for bronchial asthma and COPD. Any doubt up till here, please ask, because we have just over one more topic of respiratory system. Any doubt if you people have? I'm waiting here for 2-3 minutes. Please ask. Yes, doctor. Adrenaline can be given for acute severe attack of bronchial asthma, because adrenaline can act on beta 2 receptor. Adrenaline can act on beta 2 receptor, so we can use it, but nowadays nobody use this medicine. The reason क्या होता है डॉक्टर, एड्रेनलिन में ना टेकिकार्डियाज हो जाते हैं. तो स्टेटस एस्मेटिकस में ऑलरेडी पेशेंट को टेकिकार्डिया है, एंड इफ यू गिव एड्रेनलिन दिस विल कॉज एरिथमियाज. there's a risk of arrhythmias, right? So we don't use this medicine nowadays. After the discovery of salbutamol by inhalational route का discovery होने के बाद this adrenaline is getting outdated, right? Guys, in COPD there is no immunity involved. Immune system is not involved in COPD. COPD is destruction of bronchioles. So if you are a chronic smoker, if you take cigarettes on daily basis, your bronchioles are destroyed. Bronchial wall is destroyed. That will cause bronchospasm. So the immune process is not involved. So जो immune process is not involved, why we should give a drug which is immune pathway modulator? So there is no IgE here. There is no mast cell in COPD. There is no leukotriene involved in COPD. That's why there is no role of steroid, IgE inhibitors or leukotrienes. So COPD is just a symptomatic treatment. Status asthmaticus का single best answer क्या है? तो single best answer of status asthmaticus is salbutamol, right? Status asthmaticus, the single best answer is salbutamol. Bronchiectasis cannot be treated. Bronchitis you can treat, doctor. Bronchiectasis there is no treatment, वो तो permanent change है. You can prevent emphysema, you can prevent the complications due to chronic bronchitis, but bronchiectasis तो totally different है ना, वहाँ तो infection ज़्यादा होगा. One doctor has asked about atropine. Doctor, atropine has two contraindications we discussed yesterday. Atropine is contraindicated in glaucoma and retention of urine, if you remember. So for angle closure glaucoma, atropine is contraindicated. Atropine is contraindicated in angle closure glaucoma. Yes, leukotriene has no role in acute severe bronchial asthma because of its slow onset. Yes, in acute bronchial asthma, leukotriene blockers have no role because of the slow onset of action. One doctor is asking कि why patient who use steroids, why steroids can lead to death? Doctor, steroid will never cause death. Steroid कब death करते हैं? Steroids are wonderful drugs if you use properly. If you will not use properly, then steroids can lead to side effects, and that complications can cause death. But as such, steroid will not cause death. Steroids are wonderful drugs we have. और bronchial asthma में steroids we are giving by inhalational route. So inhalational route is one of the safest route for bronchial asthma. Other organs are minimally affected. डॉक्टर थियोफाइलिन मैकेनिज्म ऑफ एक्शन. तो थियोफाइलिन का जो मैकेनिज्म ऑफ एक्शन है, it is phosphodiesterase inhibitor. Doctor, this you have to mug up actually. I cannot give you any concept over here, right? So just you have to mug up that theophylline is a drug which is phosphodiesterase inhibitor, and therefore increase the level of cyclic AMP, and that will cause bronchodilation, and it is also adenosine blocker. So please mug up this point: phosphodiesterase inhibitor and adenosine receptor blocker, right? जो जिम वाले स्टेरॉइड्स लेते हैं, that is anabolic steroid. These are not those steroids. The steroid which we use in medical science are catabolic steroids. They have negative effect on muscles and bones. The steroids which we use in medical science are glucocorticoids. So these glucocorticoids have negative effect on bones and joints. So they are not used by the persons who are involved in gym or the bodybuilding. तो जिम और बॉडी बिल्डिंग वाले जो स्टेरॉइड्स हैं, वी कॉल देम एनाबॉलिक स्टेरॉइड्स. दोज आर डिफरेंट वन. दोज आर एक्चुअली टेस्टोस्टेरोन डिराइव्ड. दो स्टेरॉइड्स आर डिराइव्ड फ्रॉम टेस्टोस्टेरोन. तो टेस्टोस्टेरोन वाले जो स्टेरॉइड्स हैं, वी कॉल देम एनाबॉलिक स्टेरॉइड्स. दोज स्टेरॉइड्स कैन लीड टू हाई ब्लड प्रेशर. Those steroids can lead to high blood pressure, increase bone mass, muscle mass, and that will lead to that high blood pressure leads to rupture of the blood vessels of the brain. So cerebral hemorrhage होता है, that will lead to immediate death. So those steroids are not these. ये नहीं है वो steroid भाई. Doctor, status asthmaticus का diagnosis is easy. I mean, it's a clinical diagnosis, so there's no point that we will confuse in the diagnosis. So we have to give oxygen in status asthmaticus because oxygen level will go down in the patient of status asthmaticus. Plus, we have to start the medicines which immediately cause bronchodilation and can give the relief. Oral thrush में we give steroids. Sorry, oral thrush is a side effect of steroids. So oral thrush is oral candidiasis. Anyone know the drug of choice for oral candidiasis? Candidiasis का drug of choice क्या है? Anyone would like to answer? You people have covered the dermatology, right? So derma में what is the drug of choice for candidiasis? Answer is fluconazole. Like if the patient developed the side effect of candidiasis, the best medicine is fluconazole. So fluconazole is best medicine for oral thrush. Right? Okay, so the last query which I am taking, after that I'll start with the MCQs. So theophylline when given along with enzyme inducer. So theophylline is a drug which is metabolized by liver enzyme, right? And if those liver enzymes are induced by some mechanism, assume karo you have taken theophylline and you are also suffering from TB, you have taken rifampicin. So rifampicin is inducer of liver enzyme. So if those liver enzymes are induced, become more active, it means the enzymes have become more active which are involved in theophylline metabolism. So theophylline metabolism becomes very fast, and when theophylline metabolism becomes fast, this will lead to treatment failure. But if you take theophylline with a drug which is liver enzyme inhibitor, for example, you have taken theophylline with ciprofloxacin. So ciprofloxacin is liver enzyme inhibitor that will inhibit the theophylline metabolism, increase the concentration of theophylline in plasma, and result in toxicity. Right? Now, question number 1. Try to solve question number 1, 2, 3. What is the answer of question number 1, 2, 3? Anyone would like to answer? What is the answer of question number 1, 2, and 3? Answer of question number 1, 2, and 3. So mechanism of action of theophylline is phosphodiesterase inhibition. We discussed already. The second mechanism of action is adenosine receptor blocker. So phosphodiesterase inhibitor and adenosine receptor blocker. The second is leukotriene receptor antagonist is zafirlukast. So zafirlukast and montelukast are leukotriene receptor inhibitor. So leukotriene receptor inhibitor is zafirlukast and montelukast, right? So this is receptor inhibitor. Xyluton is synthesis inhibitor. So most of you have made the mistake here. Again, I'm telling you, this is very confusing. Zafirlukast, montelukast are inhibitor of receptor, but xyluton is inhibitor of synthesis. So they are asking the leukotriene receptor inhibitor. They are asking the leukotriene receptor inhibitor. Xyluton is the one which is lipoxygenase enzyme inhibitor. Xyluton is the one which is lipoxygenase enzyme inhibitor. So this medicine is inhibitor of synthesis. It's not the answer of that question. So 2 ka answer is 1. Now, what is the mechanism of action of xyluton? Xyluton mechanism of action is it is inhibitor of lipoxygenase enzyme. It is inhibitor of lipoxygenase enzyme, therefore inhibit the leukotriene synthesis. So it is leukotriene synthesis inhibitor, and zafirlukast, montelukast are leukotriene receptor inhibitor. Now they are asked which medicine is non-selective beta agonist. Which medicine is non-selective beta agonist? Question number 4. Anyone? What is the answer of question number 4? Answer is isoprenaline. Very good. So isoprenaline drug has no relation with these other drugs given in the MCQ. So all other medicines are selective beta 2 agonist. All other medicines are selective beta 2 agonist, but isoprenaline is a catecholamine. It is a catecholamine which is stimulator of all beta receptor. This is stimulator of all beta receptor. The drug is isoprenaline. Question number 5. What is the mechanism? Okay, the same question is asked again. So methylxanthine is theophylline. Methylxanthine is theophylline and its mechanism of action is same, inhibition of phosphodiesterase. Okay, which is question number 6 and 7. What is the answer of question number 6 and 7? You have to choose a medicine which is muscarinic blocker and useful for bronchial asthma, and choose a medicine which is membrane stabilizing drugs. Stabilize the membrane of mast cell, inhibit the release of leukotriene. Stabilize the membrane of mast cell and inhibit the release of leukotriene. So answer is B, Bombay. Very good. So BB is the answer. So ipratropium is muscarinic blocker and membrane stabilizing drug is sodium chromoglycate. So this is all about bronchial asthma topic, all about respiratory system, right? So if you go to the index, ANS topic we have covered. Now in this topic of ANS, one MCQ is confirmed from this topic. One MCQ is confirmed from anti-glaucoma drug, please remember, right? And in this topic of cholinergic system, please concentrate on OP poisoning. So OP poisoning is very important topic, right? Second is neostigmine is important drug. So OP poisoning, neostigmine, every year one MCQ is confirmed. So one MCQ is confirmed from these drugs. Anticholinergic drugs mein there are two contraindications, and every year they ask these two contraindication. So there are two contraindications of atropine and one MCQ is confirmed every year out of this. So one MCQ is confirmed every year from the anticholinergic drug contraindication, right? And in adrenergic drugs, in anti-adrenergic drugs, the alpha blocker topic is very important. So alpha blocker topic is important from anti-adrenergic topic, right? So this is plus minus 1. So plus minus 1 MCQ from this. So minimum 3 MCQs, maximum 4 MCQs from autonomic nervous system. Minimum 3, maximum 4 MCQs from this topic of ANS. If we talk about respiratory system, so bronchial asthma drug, 1 to 2 MCQs will be asked. So every year, it's a small topic but very very important topic. So small topic but important topic. So far we have discussed 5 to 6 MCQs of pharmacology. We are moving on to the third topic, kidney. Now from this topic of kidney, they asked one MCQ. So from this topic of kidney, one MCQ will be asked every year. From this topic of kidney, we are going to start now. And mostly they ask questions from thiazide diuretics. Mostly the question will come from thiazide diuretics or from carbonic anhydrase inhibitors. So carbonic anhydrase inhibitors and thiazide diuretics are two topics which are more important. So thiazide diuretics and carbonic anhydrase inhibitors, two topics which are more important than other. So one MCQ will be asked from this topic of kidney. So let's start this topic from page number 44. So move on to page number 44. The topic is kidney. Now guys, there is one problem here. The notes of kidney is not given correctly here. They're not in a correct sequence in this workbook. So is it possible for you people to write the notes in your notebook? So do you have notebooks with you? Can you people make notes by your hand, or should I write in this workbook only? There are two options. One option is you can write down the notes I will teach you here, and I will also write the notes with you. And if you are not comfortable in writing, I will share the file with you. Like I shared the yesterday file with many of you. So whatever we write over here, like whatever MCQs we discussed in a separate sheet, so that sheet I can share with you if you want. And if you can make by your own, that's nothing can be greater than this, because if you write anything with your own hands, if you make your notes by yourself, so those notes always remain in your mind. यहाँ पे मैं लिख नहीं पाऊंगा, दैट्स व्हाई आई एम सेइंग ना. अगर इफ यू वांट आई कैन राइट, मैं ट्राई तो करूंगा लिखने का, बट बहुत ज़्यादा कंजस्टेड हो जाएगा. सो वन स्टूडेंट इज रिक्वेस्टिंग टू राइट हेयर ओनली in workbook. So if you can write somewhere else, it's fine. Otherwise I'll share my notes with you, right? So comfortable, I hope you people are comfortable. No, there are some pages in the last of the workbook, so those pages are for antimicrobial drugs. That topic is missing in this workbook. So some part of the antimicrobial is missing, so those 10 pages are for antimicrobials. Okay, you want me to write notes in workbook only? Okay guys, I'll try to write in this workbook as much as possible, right? Okay. You people will write and you want me to share my file with you also. Okay, fine, no problem. Fine. Okay, you people can write if you want. I'll make a separate file of kidney. So this topic is kidney. The topic is kidney. The today's date is 11th of March. Sorry, 11th of September. So 11th September 2022 file I'm sharing with, I will share with you later on, right? So topic is kidney. Topic is kidney. Right, so you know that the basic functional unit of kidney is nephron. Basic functional unit of kidney is nephron, and nephron has two parts. Nephron has two parts. The first part of nephron is known as glomerulus. The first part of nephron is known as glomerulus. The second part of nephron is known as tubules. So kidney has basic functional unit nephron. Nephron has two parts. One is known as glomerulus, second is known as tubules. Now if we talk about glomerulus, in glomerulus we have BC, that is Bowman's capsule. Glomerulus में the structure is known as Bowman's capsule, right? So we have Bowman's capsule, and in tubules we have different parts. In tubules we have different parts like PCT, right? Loop of Henle, PCT, loop of Henle, then we have DCT, and finally we have collecting duct. So these are different parts of tubule. PCT full form is proximal convoluted tubule. I hope you know the full forms. Proximal convoluted tubule. LH stands for loop of Henle, and DCT stands for distal convoluted tubule, and CD stands for collecting ducts. So proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting ducts are different portions of kidney tubules. So we have glomerulus, Bowman's capsule, and tubules we have different parts. Now if I draw the structure of this nephron, which is already there in your workbook, so if you want you can refer there, or if you want you can make your own. So this is your Bowman's capsule. After Bowman's capsule, the first portion of tubule is known as PCT of kidney. After this glomerulus, the first portion is known as PCT of kidney. Then there is a bend over here. Okay? So there is a bend in. So this bend is known as loop of Henle. So after PCT, the next portion is known as loop of Henle descending limb. We have loop of Henle descending limb which will go downwards. After that we have loop of Henle ascending limb. After that we have loop of Henle ascending limb which will go upwards. Followed by we have DCT early part. We have DCT early part. Obviously the first part is early part. Now after that we have DCT late part. We have DCT late part after that. Now DCT late part and the collecting ducts, cortical part. The cortical part of collecting duct. Right? So cortical part of collecting duct. Cortical part of collecting duct and the late part of DCT have the same physiology. So I'll discuss together. And the last part is collecting duct medullary part. So we have two parts of collecting duct. One is the cortical part, the second is the medullary part. So these are the different portions of kidney tubule. The first portion is known as PCT. The second portion is descending limb of Henle. The third portion is ascending limb of Henle. Then we have this portion, we call it early DCT. Then we have late distal convoluted tubule or DCT, collecting duct cortical part and collecting duct medullary part. Right? Now in between these tubules, we have blood vessels. So in between these tubules we have blood vessels. So in between tubules we have blood vessel, like this blood vessel is there. This blood vessel is also there. So this is one more blood vessel. So in between the tubules we have blood vessels, and these blood vessels are known as vasa recta. These blood vessels are known as vasa recta. Right? So these blood vessels are known as vasa recta, which are present in between these kidney tubules. Now assume 100 sodium is filtered. Assume 100 sodium is filtered from Bowman's capsule along with some water. 100 sodium is filtered. 100 sodium is filtered from Bowman's capsule along with some water. Now what will happen in PCT of kidney? In PCT of kidney, 65% of sodium, 65% of sodium along with water, 65% of sodium along with water, 65% of sodium along with water will be reabsorbed and go back to the plasma. So out of this 100 sodium, 65% of sodium and water will go back to the plasma from this PCT only. So from this proximal convoluted tubule, 65% of sodium and water will go back to the plasma. Now the urine will take entry in descending limb of Henle. And when this urine will take entry in descending limb of Henle, now descending limb of Henle is only permeable to water. Descending limb of Henle is only permeable to water. So this water is continuously go out of the urine. So when this urine will go down, the descending limb of Henle, most of the water is reabsorbed and it will go back to the plasma. The urine become concentrated. So when the water is reabsorbed from the urine become concentrated. So this portion is only permeable to water and 20% of water is reabsorbed. 20% of water is reabsorbed from descending limb of Henle. Now the concentrated urine. Concentrated urine which is maximally concentrated in the bend of this loop of Henle. Now this concentrated urine will take entry in ascending limb of Henle. And when this concentrated urine takes entry in ascending limb of Henle, now from this concentrated urine, the ions will start going towards the plasma. So this portion is permeable only to ions. So sodium is absorbed, potassium is absorbed with the help of two chloride ions. So sodium is absorbed, potassium is absorbed with the help of two chloride ion. So this pump is sodium potassium dichloride pump, and this will absorb 20% of sodium from this part. So 20% of water is absorbed from descending limb and 20% of sodium is absorbed from ascending limb, and they are dependent on each other. This absorption of water and sodium are dependent on each other. Now look at here. If the water is absorbed from descending limb, if the water is absorbed from descending limb, then the urine become concentrated but the plasma is diluted. So plasma is diluted but the urine is concentrated. So when the water is absorbed from this urine, water is reabsorbed from the urine. So the urine become concentrated but the plasma become diluted. Now what is happening in ascending limb? In ascending limb, the urine which was concentrated, now the ions are moving from urine towards the plasma. Now when the ions are moving towards the plasma is getting concentrated but the urine is getting diluted. Have you understood this point? When the ions will move from ascending limb of Henle towards the plasma, right? So the urine will become diluted but plasma will become concentrated. And when this plasma become concentrated, then only next time water is absorbed from descending limb. So because the plasma has now become concentrated after absorbing the sodium, potassium and chloride ion, now this plasma can reabsorb water from the descending limb next time only and only if this plasma is concentrated. So plasma is concentrated, this will absorb water from the descending limb of Henle, and now the plasma become diluted again. So after absorbing water, plasma has become diluted again, and now the plasma has become diluted again, only then it can absorb ions from the ascending limb next time. So ions are absorbed, then only water is absorbed, and if the water is absorbed, then only ions are absorbed. So they are dependent on each other. So this is the function of this loop of Henle, current and counter current mechanism. They will go opposite to each other. The blood will flow in opposite direction. Ions and water will flow in different direction. The urine will go here, the blood will go there, and they are just opposite to each other, and they are dependent on each other. Now let's talk about early DCT. So 5 to 10% of sodium is absorbed from early DCT, but again the water is not absorbed. So water is not absorbed. The pump is known as sodium chloride pump. This will absorb 5 to 10% of sodium along with chloride. Now after that the urine will go to late DCT and cortical collecting duct. Now from this portion of kidney, both sodium and water are reabsorbed. So both sodium and water are reabsorbed. So sodium and water both are reabsorbed. So sodium and water both are reabsorbed with the help of a pump. The name of the pump is ENAC. The name of the pump is ENAC, which is also known as epithelial sodium channel. So with the help of epithelial sodium channel, the sodium and the water will be reabsorbed from this portion of late DCT and cortical collecting duct. Now when this sodium is reabsorbed, sodium is a positive charge which will move towards the plasma. Now from this plasma, the other positive charge will move towards the urine. So one positive charge will come to the plasma and plasma will lose the positive charge, and this positive charge is either potassium or hydrogen. So potassium and hydrogen will move towards the urine when the sodium is reabsorbed in this portion. So body will absorb sodium with the help of epithelial sodium channel. The name is ENaC. ENaC name is epithelial sodium channel, and potassium and hydrogen will come out in the urine. This is from late DCT and cortical collecting duct. Now what happens in medullary collecting duct? Now this portion is only permeable. One thing I forgot to teach you. From late DCT and cortical collecting duct, please remember 2 to 3%. 2 to 3% of sodium and water will be absorbed. So 2 to 3% of sodium and water will be absorbed from late DCT and cortical collecting duct. Now if we talk about collecting duct, the medullary part of collecting duct is only permeable to water. So this is only permeable to water, and the water absorption is variable. So water is absorbed, but this absorption of water is variable. That depends on the body requirement. If your body requires more water, so more water is retained. If your body requires less water is retained. So this is the sodium and the hydrogen regulation, sodium and the water regulation in kidney. I'm repeating again, if 100 sodium is filtered out along with water, out of this 100 sodium, 65% sodium and water will be absorbed in PCT of kidney. Then this urine will take entry in descending limb. Now descending limb is only permeable to water. There is no sodium absorbed from here. So no sodium is absorbed from here. Only water is absorbed. So 20% of water is absorbed and urine become concentrated. Now in ascending limb of Henle, this is permeable only to ions, but this is not permeable to water. So this is not permeable to water. From this portion, only ions will move towards the plasma, and this is dependent on the descending limb also. So this is current and counter current phenomena. Now in early DCT, this is permeable to only sodium, but again there is no water. So this is not permeable to water, only permeable to sodium. So 5 to 10% of sodium is absorbed. The pump is known as sodium chloride pump. So one sodium, one chloride, one positive, one negative charge will move in same direction. Now if we talk about late DCT and cortical collecting duct, now this portion is permeable to sodium and water both. So sodium and water both are absorbed with the help of this pump. The name of the pump is epithelial sodium channel. Now when the sodium and water is absorbed, this will result in removal of potassium and hydrogen from this plasma towards the urine. Now if we talk about medullary portion of collecting duct, this is only permeable to water, but there is no absorption of sodium from this place. No absorption of sodium from this place, and water is absorbed, and this depends on the required quantity, which depends on the body requirement. Now please remember, there are three hormones. There are three hormones which can act on kidney tubule. So you start from the last portion and go in the reverse order now. Start from the last portion, medullary collecting duct, and go in the reverse order. So three hormones will act at three last location of the tubule. First example is collecting duct medullary part. Now in this collecting duct medullary part, one hormone, the name is ADH, antidiuretic hormone. The name of the hormone is antidiuretic hormone. So this hormone will help in this water absorption. This hormone will act in this water absorption with the help of its receptor. The name of the receptor is V2 receptor. So antidiuretic hormone will act on its receptor in kidney. The name of the receptor is vasopressin 2 receptor. Please remember, antidiuretic hormone जो है, the other name of this hormone is vasopressin. On the basis of this vasopressin name of this ADH, we have the vasopressin 2 receptor. So ADH will act on vasopressin 2 receptor, and this will result in water absorption. Now we have one more hormone, the name is aldosterone. So aldosterone is a name of a hormone. Aldosterone is a name of a hormone. So this aldosterone hormone will act on this ENaC. Aldosterone is a hormone. With the help of its receptor, it will act on ENaC and promote the action of this ENaC. Aldosterone can promote the action of this ENaC and can lead to more absorption of sodium and water. And equally there is more loss of potassium and hydrogen. So this aldosterone will act on late DCT and cortical collecting duct. The third hormone is parathyroid hormone. Third hormone is which can act on kidney is parathyroid hormone. So parathyroid hormone will act on early portion of DCT. Parathyroid hormone will act on early portion of DCT, and this parathyroid hormone will act on calcium which is present in urine and shift this calcium towards the plasma. So parathyroid hormone promotes the action of calcium, promotes the movement of calcium from urine towards the plasma. So parathyroid hormone is a third hormone which will promote the movement of calcium towards the plasma. Right? Now you can write down the same thing in detail. Now we'll make a table and we'll write the physiology. This is the physiology basically. So physiology of kidney we have discussed. So we'll write the same physiology in a tabular form now, right? So this is a diagram, and the same physiology if I write in tabular form, then please remember the first portion of kidney is known as PCT of kidney. The second portion is loop of Henle descending limb. The third portion is known as loop of Henle ascending limb. The fourth portion is known as DCT early part. DCT early part. The fifth portion is known as DCT late part. DCT late part as well as collecting duct cortical part, as well as collecting duct cortical part, and the last portion is known as medullary part of collecting duct. The last portion is known as medullary portion of collecting duct. The last portion is known as medullary portion of collecting duct. Right? So PCT, proximal convoluted tubule, descending loop of Henle, then we have ascending loop of Henle, then we have early DCT, then we have late DCT and cortical collecting duct, and the last is medullary collecting duct. So we have different portions of kidney tubule, right? Now we discussed already, if we talk about sodium and water both together, so this portion is permeable to sodium as well as water. This portion is permeable to sodium and water both, and 65% of sodium and water will be reabsorbed. 65% of sodium and water will be reabsorbed. Now this portion is impermeable to sodium but permeable to water, and 20% of water is reabsorbed. And ascending limb of Henle is just opposite, that's why they are dependent on each other. So 20% of sodium is reabsorbed. Now if we talk about early DCT is only permeable to sodium, impermeable to water. So 5 to 10% of sodium is reabsorbed from this part. Now late DCT and the cortical portion of collecting duct, this is permeable to both sodium as well as water. So 2 to 3% of sodium and water will be reabsorbed. And medullary collecting duct is only permeable to water, and how much water is absorbed, this is variable, that depends on the body requirement. If body requires more, then more water is absorbed. If body requires less, then less water is absorbed. Right? Now which pumps are present? What are the names of pump? Which pumps are present over here? So answer is, in ascending limb of Henle, the name of the pump is sodium potassium dichloride pump. So the name of the pump is sodium potassium dichloride pump in ascending limb of Henle. In early DCT, the name of the pump is sodium chloride pump. The name of the pump is sodium chloride pump. The pump which is present in late DCT and cortical collecting duct, the name is ENAC. So this is known as epithelial sodium channel. Right? In medullary collecting duct, the pump is vasopressin 2 receptor. The pump is known as vasopressin 2 receptor. There is no special pump present in descending limb of Henle. No special pump present in descending limb of Henle. But in PCT, there is presence of many pumps. So many pumps are present in PCT. Some examples are like SGLT2. So one pump is known as SGLT2. So one pump which is present over here is SGLT2. One more pump is sodium hydrogen antiport. So we have sodium hydrogen exchanger pump. Sodium hydrogen exchanger pump. So we call it NHE. Sodium hydrogen exchanger pump is also there. So these are different types of pump present in different location. SGLT2 का full form है Sodium Glucose Transporter 2. Sodium Glucose Transporter 2, and we have one more pump that is known as Sodium Hydrogen Exchanger pump. Now apart from that, if we discuss some other points about the physiology, so that we have discussed already. So the the hormone that will act on medullary collecting duct is ADH. So antidiuretic hormone will act on this V2 receptor and can lead to water absorption. The hormone which will act over here is aldosterone. So aldosterone is a hormone that will promote the action of ENaC. This is one extra point about the physiology of this location. The hormone is aldosterone. Now parathyroid hormone will act at this location and that will lead to more calcium retention. This will cause more retention of calcium in the body. So parathyroid hormone, aldosterone hormone, antidiuretic hormone. Now if we talk about this location, ascending limb of Henle. In ascending limb of Henle, apart from sodium potassium dichloride pump, please remember calcium and magnesium are also absorbed. So we discussed already, body cannot differentiate between calcium and magnesium. So calcium and magnesium are also absorbed in ascending limb of Henle. In ascending limb of Henle, calcium and magnesium are also absorbed. Nothing important here. If we talk about this part, PCT of kidney. Now from this portion of PCT of kidney, 85% of bicarbonate ion. 85% of bicarbonate ion is also absorbed. 85% of bicarbonate ion is also absorbed with the help of an enzyme. The name of the enzyme is carbonic anhydrase enzyme. So with the help of carbonic anhydrase enzyme, 85% of bicarbonate ion is also absorbed. 85% of bicarbonate ion is absorbed at this part of kidney, that is PCT of kidney. Now coming to the drugs. Now which medicines will act on these different parts? So please remember, the medicines which will act on these different parts of kidney tubule are known as diuretics. Medicines को बोलते हैं diuretics. So diuretics are the drugs which will act on these portions of kidney tubule. Now what are the drug names which will act over here? If you look at here, the medicines are known as ADH inhibitors. So medicines को बोलते हैं हम ADH inhibitors which will act on medullary portion of kidney tubules, and these medicines are inhibitor of vasopressin 2 receptor. Medicines are known as vasopressin 2 receptor blocker. Now the drugs which will act on late DCT and cortical collecting ducts, these medicines are known as potassium sparing diuretics. These medicines are known as potassium sparing diuretics. The medicines which will act over here, medicines are known as thiazide diuretics. So thiazide diuretics will act on early DCT, and by acting on early DCT, they inhibit the sodium chloride pump and can retain the calcium. So thiazide diuretics can retain the calcium with the help of parathyroid hormone. The medicines which will act over here are known as loop diuretics. Medicines are known as loop diuretics which will act over here. The medicine which will act over here is known as osmotic diuretic. The medicine that will act over here is known as osmotic diuretic, and we have only one drug which is osmotic diuretic. The drug name is mannitol. So mannitol is the only drug which will act over here. We call it osmotic diuretic. And the medicines which will act in PCT of kidney, these medicines are number one. So we have carbonic anhydrase enzyme inhibitors. So carbonic anhydrase enzyme inhibitors will act over here. Even this osmotic diuretics will also act over here. Osmotic diuretics will also act over here. And number three, there is a group of medicines, we call them SGLT2 inhibitors. SGLT2 inhibitors, these medicines will also act over here. So these are the different groups of medicines which we have to cover in this topic of kidney. Medicines which are carbonic anhydrase inhibitors, SGLT2 inhibitors, osmotic diuretics, loop diuretics, thiazide diuretics, potassium sparing diuretics, and medicines which are ADH inhibitors. So all these drugs we have to cover in this topic of kidney. So this is the basic physiology table which we have discussed here. ठीक है, आई होप दिस फिजियोलॉजी एंड द ड्रग साइट ऑफ एक्शन इज क्लियर टू यू, राइट? So let's start with first group of medicines. Medicines are known as carbonic anhydrase enzyme inhibitor. So I'll cover only one group and after that the class is over. So you have some other class after 3 p.m. So pharma ही पे हम end करेंगे and when you come for the next class of pharma, I think tomorrow you have your class now. Tomorrow you have your pharma class. And when you come for the tomorrow, please come after revising this kidney physiology, because if you remember the kidney physiology, pharmacology is very easy to understand after that, right? So let's start with the first group of medicine. The medicines are known as carbonic anhydrase inhibitors. The first group of medicine is known as carbonic anhydrase enzyme inhibitors. So carbonic anhydrase enzyme inhibitors is the first group of medicine. Now if a question will come, what is the site of action? So a site of action is PCT of kidney. Carbonic anhydrase inhibitor, the site of action is PCT of kidney. Now they will ask you what is the mechanism of action. So site of action SOA. SOA is site of action. The answer is PCT. MOA is mechanism of action. And mechanism of action is written in front of you. Inhibitor of carbonic anhydrase enzyme. Inhibitor of carbonic anhydrase enzyme, and because of carbonic anhydrase enzyme inhibition, these medicines will cause loss of 85% of bicarbonate. So these medicines will cause loss of 85% of bicarbonate. So drugs will cause 85% of bicarbonate loss, and when this bicarbonate will go out of the body, when this bicarbonate is going out of the body, so this bicarbonate level will increase in urine. So bicarbonate is present in urine, it is not getting reabsorbed. So this bicarbonate will bind to sodium, or potassium, and can result in loss of sodium and potassium also. So this bicarbonate, which is a negative charge, will take away sodium and potassium along with it. So this will result in loss of sodium and potassium both. This will cause loss of sodium and potassium both along with bicarbonate. So bicarbonate का loss हो रहा है, and bicarbonate is a negative charge, and this bicarbonate, which is now not getting absorbed, this bicarbonate will bind to the positive charge and take away this positive charge along with it, that is sodium and potassium. Now what can be the side effect of this medicine? So when these medicines are given to a patient, these medicines will cause loss of bicarbonate from the body. And if there is a loss of bicarbonate from the body, patient will develop acidosis. As a side effect. So the medicine side effect is metabolic acidosis. So whenever there is a loss of bicarbonate, patient will develop metabolic acidosis as a side effect. This bicarbonate will also take away positive charge along with it. We discussed already. So there is a loss of sodium, loss of potassium as a side effect. So medicine will cause hyponatremia as well as hypokalemia. Now this bicarbonate can also bind to calcium. This is also a positive charge, and when this bicarbonate will bind to calcium, now this calcium is not removed. Now this calcium will deposit as calcium stones. This calcium will deposit as calcium stones in kidney. The side effect is known as renal stones. So this medicine can cause a side effect of renal stones. So bicarbonate loss will cause metabolic acidosis. This bicarbonate will take away sodium and potassium along with it. After binding with sodium and potassium in urine, this will take away sodium and potassium. The side effects are hyponatremia, hypokalemia. And when this bicarbonate will bind to calcium, it is not removed, rather this will become a stone. ये stone बनकर कहीं ना कहीं kidney में deposit होगा. So this becomes stone, and this stone will deposit somewhere in kidney cells, and this is known as kidney stone as a side effect. So these are the important side effects of the medicine. Number 1, metabolic acidosis. Number 2, hyponatremia, hypokalemia, and formation of kidney stone. Now, what are the indications of carbonic anhydrase inhibitors? Where do we use these medicines, which are known as carbonic anhydrase inhibitors? So first indication of the medicine is glaucoma. So these medicines are given for the treatment of glaucoma, right? So medicines are given for the treatment of glaucoma. So what is the mechanism of action in glaucoma? So these medicines inhibit carbonic anhydrase enzyme. Medicines will inhibit carbonic anhydrase enzyme in ciliary body of eye. So in ciliary body of eye, medicines will inhibit carbonic anhydrase enzyme, and by inhibiting carbonic anhydrase enzyme in ciliary body of eye, then these medicines will cause deficiency of bicarbonate in aqueous humor, and because of deficiency of bicarbonate in aqueous humor, there is less synthesis of aqueous humor. So medicines will reduce aqueous humor synthesis. Medicine can reduce aqueous humor synthesis by reducing the quantity of bicarbonate. So medicines block carbonic anhydrase enzyme in ciliary body of eye and therefore reduce the aqueous humor synthesis. The drugs are given for the treatment of glaucoma. So there is one drug over here. The drug name is acetazolamide. The name of the drug is acetazolamide. Acetazolamide is a drug which is given by oral or IV route, and this medicine is considered as drug of choice for acute attack of it is considered as drug of choice for acute attack of angle closure glaucoma. Please remember, there is no acute attack in closed angle in open angle glaucoma. In open angle glaucoma, we don't have the acute attack. Acute attacks are always seen in angle closure glaucoma, and acetazolamide is drug of choice for that. We have two more medicines belong to this class. Medicines are brinzolamide and dorzolamide. So brinzolamide and dorzolamide are other two medicines which are not given by oral and IV route, rather given in the form of eye drops. So these medicines are given in the form of eye drops for the treatment of glaucoma. So for the treatment of glaucoma, we can use the medicines like A, B, C, D. So A is for acetazolamide, B is for brinzolamide, D is for dorzolamide, and C is their mechanism of action, inhibitor of carbonic anhydrase. So medicines are A, B, C, D. A is for acetazolamide, B is for brinzolamide, D is for dorzolamide, and C is in their mechanism of action, inhibitor of carbonic anhydrase enzyme. So first indication is glaucoma, and they are the drug of choice for acute attack of glaucoma. Now coming to the second indication of this medicine, please remember the drug name is acetazolamide. The drug name is acetazolamide. It is a second drug of choice for raised ICT. So whenever patient ICT is raised, please remember acetazolamide is second drug of choice. Acetazolamide is a second drug of choice for raised ICT. So this medicine inhibits carbonic anhydrase enzyme given by IV route. This medicine inhibits carbonic anhydrase enzyme in choroid plexus. This medicine will inhibit carbonic anhydrase enzyme in choroid plexus of CNS. And when this medicine inhibits carbonic anhydrase enzyme in choroid plexus of CNS, then obviously CSF synthesis will be reduced. And when this CSF synthesis is reduced, medicine can reduce the intracranial tension. So medicine can reduce the intracranial tension. So I can use this medicine for the treatment of raised ICT as a second drug of choice. So second drug of choice for raised ICT, the drug name is acetazolamide, given by IV route, inhibit carbonic anhydrase enzyme in choroid plexus of CNS, reduce the CSF synthesis and reduce the ICT. Now the third indication of medicine is, this medicine is drug of choice. Acetazolamide is drug of choice for acute mountain sickness. This medicine is drug of choice for acute mountain sickness. So medicine is drug of choice for acute mountain sickness, which is also known as high altitude sickness. So what is acute mountain sickness and high altitude sickness? So whenever there is a rapid ascent, whenever there is a rapid ascent to high altitude, so whenever there is a rapid ascent to high altitude, for example, you are flying, right, with the help of aircraft, you are going to the mountain with the help of aircrafts, right? So rapid ascent to the high altitude, so rapid ascent to the high altitude, you will suffer from hypoxia at high altitude. So at high altitude, patient will suffer from hypoxia, oxygen level is low. So at high altitude, oxygen level is low, and when the oxygen level is low, you will hyperventilate, you will breathe deeply, you will hyperventilate, you will breathe deeply, you will take the long and deep breathing, hyperventilation, and in this process of hyperventilation, you will get oxygen. In this process of hyperventilation, you will get oxygen which was already less, so you will get oxygen now, but there is washout of CO2 also. So your CO2 level was not high, it was already normal. So CO2 which was normal, now this CO2 will go out of your body. So although you get oxygen, but CO2 will go out of your body, and if CO2 will go out of your body, you will develop respiratory alkalosis. You will develop respiratory alkalosis, and this respiratory alkalosis will cause the symptoms, and these symptoms are known as mountain sickness. So this respiratory alkalosis will cause symptoms which is known as mountain sickness. So whenever there is a rapid ascent, whenever there is a rapid ascent to high altitude, fast ascent like aircraft, so you will suffer, your body cannot adjust with the weather, cannot adjust with the climate, and at high altitude oxygen level is low, that will lead to hyperventilation, and because of hyperventilation, patient will take more oxygen, but patient will lose its normal carbon dioxide, and when patient will lose carbon dioxide, this will cause respiratory alkalosis, that is responsible for symptoms of mountain sickness. Now before starting the journey, before starting its patient journey, before starting the journey, if patient will take this medicine acetazolamide, if patient will take the medicine acetazolamide, this acetazolamide will cause metabolic acidosis. This will cause mild metabolic acidosis. Single dose patient will take. So patient take single dose of acetazolamide. This will cause metabolic acidosis, and this will neutralize the alkalosis. This will take care of this alkalosis. Now the symptoms will not appear. Symptoms will not appear, and you can treat or you can prevent mountain sickness. So acetazolamide is drug of choice for mountain sickness. Acetazolamide is drug of choice for mountain sickness. So first indication, acetazolamide is drug of choice for acute attack of glaucoma, where it will reduce aqueous humor synthesis. Second indication, acetazolamide is second drug of choice. It's a second drug of choice for raised ICT. Third indication, it is a drug of choice for acute mountain sickness, where it prevents the development of respiratory alkalosis. So these are the three main indications where medicines are either drug of choice or medicines are second drug of choice. The last point before winding up the lecture is contraindication. What are the contraindications of these medicines? So please remember, these medicines are not been indicated in patients of COPD. So in patients of COPD, already there is excess of CO2, and this excess of CO2 will cause respiratory acidosis. So already there is acidosis, and if you give medicines will cause more acidosis and can result in death. So COPD में patient को already there is more CO2, that will cause respiratory acidosis and that will cause death. Second is CKD. In patients of kidney disease, already patient is suffering from metabolic acidosis. In CKD patient already suffering from metabolic acidosis and drug will cause more acidosis, can result in death. Third is in liver failure patients. Please remember, in patients of liver failure, these medicines can result in encephalopathy. So liver failure के complications हैं encephalopathy. So these medicines can result in encephalopathy in patients of liver failure. That's why contraindicated. So medicines are contraindicated in patients of liver failure, in CKD and in COPD. So students, remember like this way: in patients of lung failure, that is COPD, patients of kidney failure, that is CKD, and in patients of liver failure, medicines are contraindicated. So three contraindication: lung failure, kidney failure, liver failure. The fourth contraindication is if a patient is already a known case of sulfa drug hypersensitivity. If a patient is already a known case of sulfa drug hypersensitivity, these medicines are contraindicated because these medicines have sulfa structure. So these medicines are sulfonamide in structure. So medicine का जो structure है, medicine structure is like a sulfonamide. And please remember, sulfa is a big issue. Sulfa structure is a big issue in clinics because hypersensitivity reactions are very common. So these medicines structure resemble sulfonamide. That's why medicines are contraindicated. So this lecture is over now. We have covered one group of medicine, that is carbonic anhydrase inhibitors. So this topic is over. This lecture is over. Today's lecture is over. Tomorrow we'll resume at 9 a.m. right? And tomorrow topics will be, we'll finish the kidney, we'll finish the cardiovascular system, and if time will permit us, we'll also do the GAT. So 3 topics will finish by tomorrow, right? So kidney, CVS and GAT. So these 3 topics we'll do. So if you have any doubt, you can ask. Otherwise, any student, if you don't have any doubt, you people can go for your lunch and enjoy your lunch. Doctor, in ascending limb of Henle, sodium is absorbed. There's a loss of sodium from urine, and now the sodium is going to the plasma. So sodium is absorbed, but water is not absorbed. In ascending limb of Henle, sodium is absorbed. Positive sign means, here the positive signs mean the sodium is getting absorbed, the water is not absorbed. This is the physio. The water is not absorbed. So 20% of sodium is absorbed. The quantity is around, जो negative है वो तो absorb भी नहीं हुआ ना. Only sodium is getting absorbed. So 20% sodium is absorbed. Here 20% water is absorbed. Here both. Sodium and water both. And here only sodium. So whatever is a positive, that is getting absorbed. Whatever is the positive, that is getting absorbed. Acetazolamide का onset of action is very very fast, doctor. Within half an hour, this medicine will act. So acetazolamide onset of action is very fast, right? Okay, guys, thanks for your cooperation, that you have written these notes by yourself. I know you have to put so many efforts to write down these notes, but I really appreciate your cooperation for this, because in this way, if you make the notes, this notes quality is better than the notes which are not given in a systematic manner in our workbook. This problem is only with this chapter. Rest of the chapters, the notes are fine. Yes, okay. If you want, I can share this PDF with you. So anyone who requires this PDF, just drop a message. So I will share within 1 hour, maximum by evening I'll share, right? Okay, take care guys. Enjoy.